Okay, I would like to call the January 11th, 2021 U46 Board of Education meeting to order. Roll call, please.
Mr. Devereaux?
Here.
Ms. Nolan?
Here.
Ms. Owens?
Here.
Ms. Porter?
Here.
Mrs. Smith?
Here.
Ms. Thomas?
Here.
Madam President?
Here. And can I have a motion to move into closed session to discuss individual student disciplinary matters, pending probable or imminent litigation, the appointment, employment, compensation, discipline, performance, or dismissal of specific employees, specific individuals who serve as independent contractors in a park, recreational, or educational setting, or specific volunteers, of the public or legal counsel for the public body, the purchase or lease of real property for the use of the school board, the setting of a price for the sale or lease of real property owned by the school board, collective negotiating matters between the school board and its employees or their representatives, or deliberations concerning salary schedules for one or more classes of employees, review of closed session minutes, and individual student matters.
So moved. This is Veronica.
Second, this is Eva.
Roll call, please.
Mr. Devereaux?
Yes.
Ms. Nolan?
Yes.
Ms. Owens?
Yes.
Mr. Porter?
Yes.
Mrs. Smith?
Yes.
Ms. Thomas?
Yes.
Madam President?
Yes.
I've been calling you for the past half hour. Well, because the volume on maximum. And I'm like, where did you go? Where did you go? Yeah, up to disappear. Oh, I should be heading back in here. I'm gonna go to my desk. Where? You guys, and I'll stay at my desk, so you guys come in. Nah, I don't think it's the desk. So I'm gonna go to my desk, and then I'll let you guys know if there's any couple of books coming out. If there's any visitors that are gonna come in. I see them coming out. I can see, they were right outside Tony's office. Yeah, well, apparently. Where I'll let you know. At like 3:30, 4 o'clock, they were walking around the room. They were locked. When I left, they were right, one next to the car. But I made sure to park away. All right, you guys do it. Yep. So say about you, when I get to my desk. Yes, about 6:30. That's fine. Don't give me. It's really not likely, but on the off chance they notice when the teachers are kind of bad. I think teachers are not going to be that. Mostly. Oh, I definitely would. No.
comments. On your screen, you'll see the directions on how you can make public comments this evening if you so desire. Please go to the Google form. If you intend to make a public comment, make sure you enter your name and information, and we'll be glad to call on you during the public comments portion of the meeting. This option will shut down at 7 p.m. So if you do want to make a public comment, now is your time to enter your information. Thank you.
Si gusta hacer un comentario público, por favor, use la información que está en la pantalla. A las 7 de la noche se cerrará el formulario. Gracias.
Can you zoom in on the flag during the pledge?
I guess we're ready to resume the January 11th, 2021 Board of Education meeting. First of all, I'd like to welcome everyone here. We have not seen each other for months, many of us, so it's great to see everyone in person. I should note that Governor Pritzker's COVID-19 Executive Order number 70 is still in effect. However, most of the Board of Education is here in person. In addition, many of the administrators who are presenting tonight are also here in the building. We are spread out. We have very limited seating in the boardroom, and there is overflow seating in other places in the building. And I also want to thank Brian Leatherby, the high school auditorium managers, people from information systems who spent a lot of time last week cabling, figuring out how to get this to work, since we didn't want to have the feedback that we had when we tried this before, so we're doing something a different way. So thank you all very much for your work on that. All right, if we could stand for the Pledge of Allegiance and then remain standing for a moment of silence.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
With liberty.
We'd like to take a moment of silence for two U46 employees who recently passed away. First, we would like to remember Steve Gallus, a system engineer in information services who worked for U46 for 8 years. Steve passed away on December 20th at the age of 34. Steve's co-workers say he was very proud of supporting U46 families and was excited every time he finished, even more so when he could save the district money. He enjoyed indie music, attending concerts in his free time, and loved to barbecue, often bringing in food to share with the team. Steve is survived by his parents, Jeffrey and Karen Gallus, his faithful dog, Dude, and a number of aunts, uncles, and cousins. A memorial service will be scheduled at a later date. We'll keep Steve's family and friends in our thoughts and prayers. We also remember Yadira Lopez, who taught Spanish and AP Spanish literature at South Elgin High School the last 2 years. Yadira was the Larkin graduate who did her student teaching at Elgin High School. She passed away on December 27th at the age of 32. Yadira was known for her friendly, upbeat nature and the close relationships she developed with her students. She believed in the power of professional development and collaboration with other educators. Yadira is survived by her parents, Jose Luis Lopez and Gloria Perez. A funeral service was held on January 4th at St. Mary's Catholic Church in Elgin. We will keep Yadira's family and friends in our thoughts and prayers. Thank you all. All right, first item on the agenda, Mr. Sanders, is strategic plan report.
Thank you, Madam President, members of the Board of Education. Let me agree that it is great to see you all in person. It's been a while. So this evening we annually present the Board of Education an update on school safety and security. Mr. Heiderscheit, the board is certainly familiar with Mr. Heiderscheit and his annual report to the board. This time, because of the pandemic and our return to school beginning tomorrow for a hybrid, we thought it would be a good opportunity to share some of the preparedness we've gone through in the midst of the pandemic to make sure our schools are safe places for students and staff. Mr. Heiderscheit, are you able to share? You are able to share the PowerPoint on the screen? There we go. As he does so, let me just note that joining Mr. Heiderscheit for this annual report to the board is Jeff Judge, who's our health services coordinator. And we also have Suzanne Johnson, our deputy superintendent for instruction. Online on the Zoom call, in addition to these presenters, we also have Jeffrey Prowl, our director of transportation, Bruce Phelps, our director of business services, and Sheila Downs, our director of plant operations, who are available to answer board questions as well. I want to note that we are truly blessed in U46 to have such an experienced staff in the area of school safety and security. Jeff Judge comes to U46, actually came to U46, I think six years ago. And prior to joining us, he was the emergency preparedness coordinator for Norwegian American Hospital in Chicago. Before that, he had extensive experience working as a nurse and ER person at Resurrection Medical Center from 1993 until he joined Norwegian. And like many of our healthcare staff, not only is he engaged in our work here, but he's also spends his free time when he has some working in a hospital, working with COVID patients during the midst of this pandemic. You all know John Heiderscheit. To remind you, John Heiderscheit came to this district about 14 years ago. We separated by about 8 months that he's been here before I joined U46. He has been started off as our coordinator of school safety and security. Now he's director of school safety and culture. Prior to joining U46, he had a background with the Buffalo Grove Police Department, where he was also an SRO. He is highly regarded in the field, not only starting up the Northern Illinois School Safety Association, but also in his NIM certification and work with crisis prevention intervention. So again, we're lucky to have the expertise in-house to lead this work. And with that, I'll hand it over to Mr. Heiderscheit to kick us off.
Thank you very much, Mr. Sanders and Superintendent Sanders, Honorable Board President and Honorable Board members. I appreciate your attention today. Jeff Judge is with me at my right, if you're looking at my back, and Dr. Suzanne Johnson on my left. So we're here to answer any questions you might have and make this presentation. Wanted to start off by kind of going backwards a little, back to March and actually back to February and January. Mr. Sanders and I and Jeff started having discussions about the oncoming pandemic and those discussions on comparing our procedures that we have used since the 2009 pandemic and bringing that daily situational updates to our administration and to the leaders of the organization, monitoring the situation as it was occurring internationally, using our procedures that we put in place for additional cleaning, or what we called deep cleaning at the time, making sure those were in place. And we've had a sick monitoring system in what we call My Data Zone. If you're familiar, that's our data gathering system it's attached to Infinite Campus, our student information system. And with that, we developed a long time ago, many years ago, ability to watch our daily student attendance, and when it reached a certain sick level or a certain flu level of those two codes or differently, it would alert us, and we'd be monitoring that to ensure that we're communicating with our county health departments and working towards contagious disease mitigation. Our plant operations department has been deeply involved in the additional cleaning and finding ways to make our schools safer through that cleaning to limit the sick days, the number of sick days, so we can keep students in their seats and teachers before them. So an incident command, that we actually began incident command, that is a term used by the National Incident Management System. That is an international, in the United States, that is the system that I could leave here and go and plug into a school district anywhere, or a fire department or a police department, any type of emergency management. And we're trained the same way and the same method, so we use same common terminology. So we did start that in beginning of March, end of February, and we used what's called incident command to start managing our daily operations. And what that means is one of the caveats to incident command is having a daily situational update, so we keep everybody informed on what's happening, and then we bring people together to then solve problems and and mitigate the situation. Prevent, mitigate, respond, and recover is really the terminology. So April through June, as the schools buildings were closed and the communities were put into lockdown, we developed the COVID continuity of operations team. Continuity is really the idea of if I was to get sick, I have 3 people lined up behind me that are ready to take over and trained and be able to kind of move through the situation as they're up to date and they're up to speed and they could take over. If Tony was to get the sick, who's next, anybody and all down the line. And then we named certain people to be certain positions. So the information officer is Mary Fergus, as you know. The incident commander was myself. Jeff Judge was our safety officer, and we worked very well hand in hand together through this whole thing. And then our operational teams would be Bruce Phelps for getting Chromebooks and distribution for principals, distributing the items that were still left in schools, and so on. So closing out the school year was very important. Maintaining maintaining our incident command and continuity of operations was very important. We started out with daily meetings. We reduced those to 3 days a week, and now we still meet on a weekly basis. Monday mornings, 10 o'clock. The continuity of operations team still meets. And what we decided very early on, sometime in December, is that transparency in our procedures was going to be vitally important to our employee groups who were going to be having anxiety about coming back to our buildings at some point. And that transparency was the intranet that we built out in the safety site. So it was a safety place already on the staff intranet. And we built all of our procedures from the state and from the CDC, and we made our own documents out of them and basically made them so all could see, not expecting every employee to read that word for word, but certainly having a landing place that if you wanted to check up on what I'm saying and what I'm doing, or you needed to verify something, it was there for you. Any employee could find that, any employee could see that. So administrative procedures were very important in having it written down so we can have stability through the organization. Incident management continued, and we closed out the year very successfully, and we started feeding children at the masses. So the meals continued throughout the summer. This is what the staff intranet looks like. I'm going to take just a moment to work through this. Your normal login and password is what gets you into the staff intranet. And in that, when you're logged in, you'll come to the case reporting. Jeff Judge will show you some of that. These 3 first icons here are all about COVID-19 administrative procedures, staff safety guidance, which mirrors our public website, and our reporting and suspected cases. We decided early on that we would be very, very transparent about the cases that were ongoing at schools or open, cases that were closed and no longer suspected to be any type of contagion, and then our confirmed cases, positive cases in the communities in which they are, and the procedures that went along with that. The procedures that went along with that as far as what happens when there is a notification of a confirmed case or a suspected case. What happens, what flow chart does that work through, and where does that end up? So we worked to keep that as up to date as possible, and I can tell you right now, we went through a complete wash of those procedures, all of these intranet sites to make sure everything's up to speed. This safety guidance for staff is basically a quick look here at the big deals, right? Assume everyone has COVID, monitor your own health, wear a mask, stay 6 feet apart, wash your hands, and hold others accountable to your expectations. There's some training videos here that Jeff and I have given to all staff as they've moved back into the buildings. A few weeks before they would come back in for in-person learning, we would give a safety presentation first, always leading with safety, and then curriculum, and then the other needs that the teachers would have to help them in this new environment that we're in. Link to the safety video that Mr. Sanders did with the additional principals and students. How to self-certify, and then these are what's called accordions. So everything about self-certify, masks, and this is kind of the quick way and the summary way to give this information to staff in whatever way they can, and working down all of these cleaning and disinfecting procedures and linking these into the library of safety procedures, contact tracing, and so on, down to the new sites of the FFCRA benefits, those decisions that were made about benefits that were going forward, vaccines that Jeff Judge is working very, very, very hard in, numerous hours that is really paying its benefits, and more resources and more availabilities to whatever staff we could think needs. And we do hear what staff wants in all the collaboration committees that we have. So when we hear staff saying, I need to see this, I need to see that in our various committee meetings, that's what we do, and we answer it in this presentation, in this format. Sorry. So that's the staff intranet. As planning went on for the 2020-2021 school year, learning transition teams were started to develop, and that was sometime at the end of June. You'll remember that. Some of you participated in those committees. The continuity of operations continued. So what we did is the transition teams that were developed, they would ask safety questions. They would come back to continuity of operation teams. We would collaborate with all the staff that were involved with that and keep that collaboration going. Somewhere into August, it was really apparent that a specific safety operational subcommittee of those learning transition teams was necessary. And we brought the leadership of the labor groups and others to that with the continuity of operations teams. So the continuity of operations team started attending 2 meetings regarding safety procedures with other staff in all of our labor groups. And that was to really develop a very collaborative way and an informative way. And we don't always see what they see. Boots on the ground view is very important. So we wanted to develop our best view from boots on the ground that we could see that would help staff reduce anxiety and be in the safest places possible. The Safety Council, if you may have not remember what Safety Council is, it's in the ETA contract that was negotiated last time, and that council started last year. And myself and a team of administrators meet with every month or bi-monthly. The ETA leadership, Barb Bettis and I collaborate on that committee. We have a steering committee by contract. And we made a very early decision sometime in August to really focus our efforts on pandemic safety and bringing that collaboration and that information together as much as we could. So that's the 2 main safety committees that are collaborating within the organization. So we did learn that there's a lot of logistics, supply needs, procedural needs, a lot of things that we learned. Jeff Judge would tell you that, we were scrambling for PPE at the end of the school year, and we really determined that schools were buying PPE on their own for their classroom activities or whatever that might be, for gloves or whatever, and we couldn't do that anymore. That was not a good way to go. So we institutionalized it. Now it's in the catalog, and we'll show you some of that information. So making all of the work that they were going out and getting themselves and making it institutionalized as a business process. It really was one of the decisions that was a really good decision by Bruce Phelps and his team. And the collaboration with staff on these items, what they need, what they thought they need, hearing the statements from staff that I always got to beg, plead, and borrow for a mask or for a gloves to do my job, and we really needed to change that and change that approach. What else do we need to do regarding training, supplies, equipment? Procedural needs to resolve inconsistencies, drive at training for administrators to resolve inconsistencies, build trust as we could with transparency and having all administrators on the same page, which is sometimes difficult, sometimes like herding cats, but ultimately that we develop certain ways of having a pacing of meetings, and every week now that we have administrator training that they all must attend. It's a continuous focus on employee experience at all of our sites. So other things that we collaborated on is that annually in the ETA contract, there's the adequate housing survey. Our safety council and our safety subcommittee made the decisions to make the adequate housing survey a school department and building rep function with the administrators to then really go and address the pandemic safety needs. And that was the focus of the adequate housing survey. So that was one of the things that we collaborated on and made those very specific and agreed upon things that the building rep and the administrator at each building would go see to make sure they're in place and then report back to the school department committee. We developed scenarios together. Our collaborations, what are the weak points and what are you seeing and what are we going to have here? So we built scenarios for each principal to run with their team at their buildings for the principal to run a scenario on these action steps and these procedures. So then, they can show staff what these procedures are so we can grow confidence in the procedures that we have in place. And really both committees reviewed the wording for the presentation of data on the intranet, on the internet of the caseloads. We decided, and we had many conversations, I believe anyway, on the GCN training platform, is that we were thinking that we should, make our own videos of training. Do we just use the CDC videos? What is the training platforms that we need to use? And as a collaborative, we decided that the GCN platform was the best. They helped review those to make sure that they were doing the job. And GCN was it because that's what most employees knew and that's what they were familiar with. So that's what we drove into with GCN, and that's why we decided to stay with that platform. There are 6 courses. First, it started out with 2 or 3. Now there's 6. So we've asked all employees to make sure they take those 6. Scenarios developed for principals to use, and I already talked about the scenarios. And those scenarios I wanted to mention here were attached to the adequate housing survey. So what we did is try to attach all things and make things work in concert. And that was a collaborative build out of that in our committees to make sure that we started with a base and then built from there and then had scenarios to train in that base. Logistics. These are some of the logistics from Distribution Center and Bruce Phelps, just to give you an idea of what we had on hand, what we have on hand currently, and what we've purchased over the summer and into this time period. We have enough masks and hand sanitizer, hand washing equipment, face shields. We don't want to simply just, give up and here, take one every day we need a medical model kind of conservation plan, but ultimately we have the supplies for a staff member to feel safe. And if they need to wear a different mask every day and they need to do that, we are here to supply that because we want staff to feel safe in the environments in the mitigation plan that we've created, through the help, of course, of the Illinois Department of Public Health and the CDC. So those are some of the numbers that are in place there and those expenses. So in this plan operations developed many things, many standard operating procedures, from the top 20 COVID considerations for an administrator and a principal team to watch and to go do and to check these 20 top things, to rolling out portable hand washing stations that were purchased by the distribution center, to using the touch point disinfection guide with the materials purchased by research to what takes care of COVID and what takes care of what's on surfaces, the HVA systems, and the expansion of the HVA systems and the depth of the filters that we're using now, from plexiglass to created COVID cleaning procedures that are, we call them now, we used to call them the deep cleaning and the ordered up cleaning. Well, now that's the standard cleaning. So it's no longer you have to order it or ask for it. This is what we do on a daily basis and a nightly basis. So just some of the topics there. This is an example of the ventilation systems. Sheila Downs, the MERV 11 and the MERV 13, those are the industry standard and the best practice for your air handlers and your air distribution. I'm not an HVA person, so I'll get all the names wrong. But this is from Sheila. And then the air handler systems are now 2 hours before school starts, active and running. And then after school is over and the kids are and the staff are moved out of the building, they're still running for 2 hours after. So those ventilation systems, they used to be half an hour or an hour before school started. We used to turn them on. Now it's 2 hours on either side to increase the ventilation systems according to the CDC guidelines and our best practices, what we believe is the safest thing to do. All the cleaning things that are done, I'm probably not going to get the terminology correct, but we've established a plan. That plan I talked about, that it's no longer just the daily stuff or the deep, ordering up a deep cleaning. That is our standard routine. We're working on, we have completed procedures for administrators to really do walkthroughs with their custodians first thing in the morning. The plant operations has always had an emergency call number at 5060. So whatever needs need to be taken care of, wherever we might get a report of a possible COVID case, whatever time of the day that might be, we have the ability to respond to that. And at the secondary and the elementary site, additional ABM cleaners, the contracted cleaners, are going to be doing the COVID cleaning, the touch point cleaning, the surface cleaning, certainly on a nightly basis and during the day, during the school day. These are the cleaning supplies. The Sandy Spritz Spray was researched by Distribution Center. This has a dwell time of 3 minutes. What that means is if I spray it on a surface and I let it sit, if there was COVID on that surface in those 3 minutes, that dwell time, that would kill the COVID, according to what the chemical and what research the Distribution Center did that. These three supplies, Sandy Spritz Spray with a sprayer, the hand sanitizer that's non-alcoholic, and the paper towels are in each classroom. That was done by the Distribution Center and then moved by the custodial staff to be in each classroom. This is really a switch for us and institutionalizing cleaning and supplies in the classroom. That has never been done before in the district, to where we have it as an institutionalized process. And then the hand washing stations were really a collaborative effort, at least in the business continuity team, to get the best product we could for the size of the student, if you will, because these here are a bit smaller than these large ones in the high school settings and the middle school settings. Cleaning, sharing objects is really discouraged. Sharing objects is discouraged to the point where we really want students to have their own stuff and keep their own stuff. We want you to come to school, and then we want you to take your stuff home with you, especially during inclement weather times like the winter. The same for staff. Bring your stuff, keep your stuff, don't share your stuff, and then take your stuff home every night, your computer, whatever, your Chromebook, whatever that might be. It's really important that you have your resources with you. High-touch materials, to the extent that's going to be cleaned, as we talked about. Avoiding sharing the objects, but sometimes that cannot be always done. So if you do share an object, the best thing you could have ever done is, and we always do, is wash our hands. Wash your hands. So an example would be the playgrounds. If we're talking about food service area, if we're talking about, and that wouldn't be in the classroom, but that would be in a designated area if there is snacks being eaten or whatever that might be in the schools. Wherever those places might be, that's why the hand washing stations are out there. The best thing that we could do is wash our hands with soap and water. Second best is hand sanitizer. Second best is hand sanitizer. Through collaboration, we brought forward the social emotional team that moved towards Kathy Kettle and pretty early on when I segued to the safety subcommittee, and the presentation around Maslow before Bloom. You may remember some of that. Social emotional wellness. We worked on threat of harm to self, because that was one of the early concerns that we heard from staff. What if a student does something that appears to be a threat of harm to self or others on a digital meeting? So we worked on a procedure for that very early on. I think that dates back to April, and any type of process that we have in place for any types of those wellness. We also started working on the refusal to resistance to wear face coverings, and we worked on that in the process when the board were deciding to approve the current guide of the student safety code of conduct for this year. And we did talk about building that into our current process and not making a special process out of that. So that's where we landed. And we do have a 3-page process for that, starting on page 37 of the staff guide to the student code of conduct, which is distributed to all teachers and linked in several places on these procedures. Assessing student needs within safety guidelines. This was just a quote from the special ed department, Dr. Josh Carpenter and his team. During the summer, we developed a way and a process and a procedure to then safely assess all of the students that need to be assessed, even during high transmission times over the summer when many things were still happening. And this procedure, we were able to assess hundreds and hundreds of students safely with staff having the PPE that they needed. You can see that there's 4 tables here that are separated. That's about 8 feet of separation. And there's some other tools tools and cleaning supplies all ready here. So the family would sit here, the student would sit here, the staff member would sit here, and they were able to do their assessments very effectively and to get that work done. And we still continue with this procedure now. These signs that we bring forward are the signs that were done through collaboration. The decisions were to use the Illinois Department of Health, which weren't really complete. Do we use the county's sign? Whose sign do we use? Because where we came with this is that in the pandemic of 2009, we used a cover your cough, cover your sneeze, wash your hands sign that we put in all bathrooms from the CDC at that time. If you may have been in our bathrooms, you might have seen it. It was black with some green lettering, and then we took those down, or some of them are still up in some places, but we replaced them with all of these signs, and these signs were chosen through collaboration. This was not a unilateral decision. We made a decision together on what signs would be best, and we landed the CDC signs. So those are the signs that you see, keeping with the best practice of the CDC. And then Bruce Phelps and Company in the distribution, these are your 6 foot distance. We have some variations of these in schools where they use more. We certainly have ample supplies. The one-way, we decided not to go as a collaborative with one-way hallways or one-way stairways, as that would be an awful lot to administrate and manage, regardless of how well we train the kids. People would forget. I certainly forget in the grocery stores or Menards. I go the wrong way when the arrow says, anyway, I'll be quiet. Open by appointment only was a decision to make sure that we have people coming in when we know they're coming in. Schools were given the discretion that if they had nobody else in the office, they could certainly accept a guest, but they would have to make some kind of communication. The phone number is supposed to be posted on the sign at the door, and elevator use signs. These are the big 4. Significantly reduce your likelihood of exposure, monitor your symptoms. I'm going to go through actually a self-certify with you here in the room or on the Zoom, walk through that, and the properly wearing your face covering, socially distance, keep 6 feet apart, and wash your hands frequently. My message that I have on my email and everywhere I go is please assume everyone has COVID-19. That will drive your behavior to change and make sure you're the 6 feet away. Monitor your own health. Wear a mask, stay 6 feet, wash your hands a lot, and hold others accountable to your safety expectations. We heard from our collaboration teams that staff might not feel comfortable saying to their boss, you're not wearing your mask. And we needed to decouple that thought. So we've been on a real explicit, to all of our administrators, make sure it's okay. That is a good thing. Make sure everybody can correct everybody, students included, can correct any adult behavior about wearing your mask or staying 6 feet apart.
Hey, John, if I didn't have my mask on, what would you do?
I'd leave. No, Mr. Sanders, could you please put your mask on? You're making me feel uncomfortable.
Thank you.
I don't feel
And
safe
you have
around
permission to do that.
Thank you, sir. So right here, I'm going to run through the self-certification process. I don't know that if you had an opportunity to go through this. I encourage everyone to go ahead and go through the process. But it's not a pass or fail test, and I irritate Tony. Probably don't irritate him, but I call his attention to it quite frequently because I show and tell this. I am a staff member. I'm sorry, I'm already. With any staff member, it is your normal login and password. Your normal login and password. With any parent, it is their Infinite Campus login and password. And if you are a parent and you don't remember your login and password, that links you to a video, a process, and help services here. And they've been trying to help all parents that call, not trying. They have been helping all parents that call. So running through this process, the first question, does anyone who lives in your home currently have symptoms of COVID-19? At first, we did not use this question. We just use it as a kind of like a red glaring sign, hey, remember, and we found that wasn't good enough. In fact, Jeff said, John, stop it. That's not good enough, and we got to do better. So we made it a question because that was my idea by just making it a sign. So taking collective feedback. Okay, so does anyone in your home currently have COVID? Well, I did have a situation in my home where that did occur. So if I said yes, it would say stop, do not go to work based on your response for having symptoms of COVID-19, notify your supervisor. And we want staff to be calling their supervisor. This is not the method just to call staff.
And then as John's supervisor, I just got an email saying that Mr. Heiderscheit entered that a family member has COVID. And that way, even if he doesn't call me, I know.
Additionally, I believe you get it too, don't you?
I get all of them. Yeah.
So Jeff gets them also. So I'm going to go back to the main menu and I'm going to update my status. Any staff member, if you if you did an accidental entry, you can update your status right away. So I went back and so no, I don't have anybody in my house that has any kind of like symptoms. But you know what? I have a sore throat and I have a cough. And you know, these symptoms I am reporting, they're new to me, not related to any pre-existing condition. So that's yes. Stop, notify your supervisor. Please don't go to work. And the students would get the same responses. So when your guardians for our students enter these responses, they will direct them very clearly. Should I go home?
No, I got my alert that you also did it again.
Okay, sorry, boss. All right, so I'm going to update my status again. So I don't have anybody in a household right now with any kind of COVID-like symptoms. I don't have any symptoms here, but I do have a fever. Same thing. So it kind of follows the same path and it does the same notifications and repeatedly does that and shows that. So now if I have no symptoms and I have no fever, it gives me the clear. So the clear check mark is something we're going to use for secondary schools and we'd be able to have some display there. We're working to finalize that. But ultimately here, we do have a pathway. It's really well done. This goes into a reporting system here that I can run this. This is live always. It's always live. So as administrators, we can run this. Our secretaries, our nurses, we can run, multiple people can see this report. We can run this. So if I go down to a school, I could get this report. I'm not going to pop that up here because it's going to have student names in it. I'll show you that screen in just a second. If I was going to do my administrative, my report, like everybody underneath me, I could get that report. It basically shows as a, it's going to show as a Excel document. It downloads here. It pops up here. And suddenly I'm into all the information I need to have about my staff, who all's in my staff and the times and the dates, the very exacting times that they have that they self-certified. So we're going to be able to help staff. Hey, I noticed that you were at, 7:30, you were just walking the door. Can you get yourself certified a little bit earlier, right? As far as for staff, even the principals can kind of make it some notifications about that regarding students and so on. So we believe that, the ISS, Brian Warnock, commendable job in getting this in a place, because what I'd like to show you here next is that this is the type of report that we've built out. And we didn't do this originally. This took some time to learn how to make it more efficient for administrators. So in the beginning, it went slow. You're going to hear, right? You might have heard some staff being very concerned because it didn't go. It was 11 o'clock. It was this, it was, and right. Yeah, rightfully so. We're learning and learning and learning. So there are two email reports that go out to administrators, the principals, the nurse, whoever that might be, the not submitted and the symptomatic. And those are actually pushed at a certain time to those folks via email. But like I said, the administrator can go in there and run this anytime. We also made this where the overall report would show symptomatic students, household, and what this says is in-person day for this student, yes or no. So we know through Infinite Campus who's in school now and who wasn't. We didn't have that originally when this first rolled out in person. So we've improved this substantially in substantial ways through listening to our subcommittees, listening to our collaborative, saying this isn't good enough. This isn't good enough. So we've worked to improve this as really, and we believe that we're in a place where this is the right place to be. So guardian, who is that? Cell phone number, home phone number, work phone number, email. This gets right to the secretary right now. They can click the email. It'll go to their email. They could email that parent right away. They could call them. In other words, they don't have to log into Infinite Campus like they did before and look for the phone number. It's right here. It's right now. So kudos to our information services department for making an app. It's not really an app. It's a web program. Step 2, cover up, wear a mask. We do have very rare occasions where you're going to have a medical contradiction to a mask, where we have heard concerns about that. That's been a concern we hear frequently. It's a very rare situation. They do have to have a doctor's note that has to go to the nurse at the school. So the nurse will be informing the principal, and the staff that need to know if a student has a medical contradiction will be informed. will be informed. And if that's even includes hallway monitors, of course, they would be informed. These situations would be very rare. We don't see them very often, and we're working to track that also in each school on how many students would be. But for right now, we do have a communication plan in our procedures, in our pandemic procedures, that says we will share this information. Step 3, the big 4 is this, the maintaining social distance. What you're seeing here is a slide and a visual that we use in our CPI, Crisis Prevention Institute training. If there is an escalating student, we want to back up and make space because that's going to de-escalate the situation and communicate respect. That's usually about 6 feet outside what's called the personal zone. And we want at least a minimum 6 feet when we're working with kids as you are set up in here tonight. So be comfortable with that. If you're not, bring a tape measure, put it on your belt. We have all kinds of ways, right? Everybody has ways to learn what the 6 feet is as we start gathering. But we have to remember that we do have staff that have not been at the workplace since March. And there's going to be a lot of anxiety and a lot of things. So that the teaching aspect of this is going to be repeated. And as we keep on teaching in our growth mindset, providing feedback so we can all learn from our feedback, everybody involved with this. We developed this in our department with our CERT social workers, the COVID safe zones and the COVID unsafe zones. Rob Luck is a CPI certified instructor, and he developed this and really like it. It really kind of shows, hey, if we're this close, it's not safe. Let's back up. We can have some close contact, but we're limiting that to under 15 minutes cumulative for the day. Hand washing stations. I guess hand washing, it's soap and water is the best. 20 seconds at least, right? If not longer. Keep washing those hands in the cuticles and everything. Have students wash their hands. That's what those stations are there for. The second best is hand sanitizer. Get to a hand washing station as fast as you can, even if you used hand sanitizer. Playgrounds, toys, items, lockers, and cubbies. We do not encourage the use of shared objects. Our playgrounds are open. We ask you to wash your hands before you use them and wash your hands after them. So our playgrounds are open. Manipulatives are available, but we ask you to not share them. In some cases in early learning, that might not be purely possible. So wash your hands frequently and wash your hands often. So we're going to spend more time away from the classroom doing our safety procedures in the beginning. And as we grow and learn how to do this together, we should be able to increase the classroom and learning time. Visitor systems are that all visitors must be by appointment. Please, parents, no surprise drop-offs. Staff may refuse you if they have too many people in the front office. You may have to go back home and come back again. So all parents and guardians know that visitors, please call first, make an appointment, let us know that you're coming. We're welcoming you and happy to have you there. But if you're in the building, you must be signed in with our Raptor system, our visitor management system that has COVID screener questions. And we must also document your presence in our building in case we needed it for contact tracing of any kind. That's how we document everybody in. Either use the fob to get in, or if you were let in, you're in the visitor management system. So that's what we expect to see. And we've had a group of interns from NIU, that intern program, if you remember, that I have. We've been actually doing walks at all schools and having seen great results in the procedures that are in place and the visitor management systems that are working up and running. Student resistant to PPE. Again, this is a 3-page procedure laid out in the best terms of MTSS and the layers of student code of conduct and how to run through that system is laid out very clearly. This was all the way back before the summer, reminding us that when we are dealing with a refusal in CPI, and it's in the defensive stage, there's something that's challenging the student, that they're not following that rule, and that refusal is telling us there's an unwillingness to cooperate or follow instructions. If that's the case, limit setting, be respectful, be simple, and be reasonable. Give the when-then statement and if-then statement. If there's no cooperation there, then immediately notify your supervisor. And we want a behavior event entered into Infinite Campus and we need that followed up with a parent contact. That's the explanation of the behavior event in Infinite Campus, because as you know, as a board, what you approve in the student code of conduct at any level, there should be parent contact if there's a behavior event. So that's why we made it working in that regard, because there is a challenging situation and there's a student unwillingness to cooperate with the rules. The behavior code is going to be for unsafe behavior, and that's a code we've had in the student code of conduct for quite some time. Communications, in our presentation here, there's this came from the CAC subcommittee for safety. They said, hey, you don't have safety really easy to find, so we made it on the ribbon for parents and for the public, and it has the same type of accordion features here for reporting the numbers. This is the public website, self-certification. You have U46 safety and ready to learn tips, COVID notifications, flow charts. I'm just kind of flying right through it, but all these safety measures are in the same type of accordion, same type of videos, consistent, same type of words, and same type of accordion, all kind of laid out for parents to experience our safety procedures. This is from Jeff Prowl. I loved the picture that he used. He's going to be using for administrator training of our bus wearing a mask and all masked up and ready to go. The transportation department really laid out a really nice procedure that allows all staff to see, but administrators to know, is that when you're getting on the bus, it's going to be one student at a time. They're going to go to the back of the bus. We don't want kids crossing. So the bus driver is going to be guiding that procedure of kids getting on the bus. One student per seat, unless they're in the same family. And then as they're getting off the bus, it'll be front to back. The students in the front will get off one at a time, one seat at a time, and to the best of our ability, we'll have students spaced out. So the message to administrators and to teachers is it's going to go slower. It's going to go slower. It's not going to go as fast. So do expect that it's going to go a little bit slower. And the cleaning procedures after every run, the cleaning products that are used, all of that is laid out in this procedure. So everybody's on the same page. You have to have a mask to get on a bus. You should be wearing your mask at the bus stop. You should be socially distanced at the bus stop. We do understand it's going to go a little slower, but it is for everybody's safety, because in-person learning is really desperately important for our kids right now and the families that need to send them to school. Contact tracing. This is Jeff Judge's slide. He's going to cover some information here, and then I'll close this up when he's finished.
John, are you going to keep going? You want me to share my screen?
I can keep going.
Okay, great. Hi, good evening, everyone. Thank you so much. So contact tracing, so that's something that we started early in February of 2020, which I think our district is. Thank you, Mr. Sanders, for being so amenable to allowing me to start that so early on. So contact tracing, just identifying symptomatic individuals very rapidly, identification of those that are potentially exposed, and obviously trying to mitigate the spread of COVID-19. So again, we started early in February. By May, we realized we needed to implement a new system, so we started an automated form. By August, I had to add on 2 additional full-time nursing staff, train them, dedicated them completely to contact tracing for our school district. By September, we upgraded to a new online form, which I'll show you in just a moment, which I think is pretty impressive. In October, again, we expanded rather largely. All registered nurses and certified school nurses were trained in contact tracing. So not only did we have a centralized contact tracing center, but each individual site had a contact tracing available for students per building. We utilized 6 additional health services staff for continued contact tracing at ESC. And currently we have 3 levels. We have Office 121 here at ESC with a set of contact tracers. We have 239 and 339. So we have 3 levels of contact tracers, 3 teams, just in case one level, if something should occur, if there's an exposure, then our contact tracing can keep going through no matter what. We have also established an intern program. So through that collaboration with safety and security, we have 5 more interns coming and starting in January. So we've really expanded our contact tracing team. So all our contact tracers have completed the John Hobson's contact tracing course, as well as the Kane County contact tracing course. They have received extensive additional training specific to U46 and our protocols. We are exceptionally mindful of HIPAA and FERPA compliance, and that is strictly enforced and adhered to. All contact tracing calls are confidential because we do want to encourage our staff and families to feel free to communicate with us and to share valuable information. Another really unique feature is that we've collaborated uniquely to establish a confidential relationship with human resources, especially our benefits department, so that there's only a rare specified set of benefits personnel who works directly with us. So all of human resources doesn't get the confidential information, only a pre-approved set human resources staff. So everything remains confidential. So really our initial process is investigation, but it's way more than that. We're working to provide support, follow-up with staff, families, and students, providing education and information, maintaining compliance with the health departments, specifically for the completion of quarantine, symptom checking and monitoring, and making sure that we have absolute release and have met criteria for return to in-person learning or in-person work. And HR, of course, is partnered with us, so they are the final, so they do the final check to make sure that we are compliant from their end as well for staff to return to work. Thank you, John. So school communications and case reporting, our new program, which we established, you can go ahead and click that, that'd be great. Keeps track, and this is live. I can run this report, and so can John, or so can Mr. Sanders, but this is updated every day, and it gives a complete number of all the cases at each site. Open cases, which means they're under investigation, closed, which means they've completed the cases, and then identification of positive cases. And if you scroll up just a little bit, you can see that our contact tracers have worked really hard, and we have at this point, stop right there, John, thanks. At this point, we still have 587 open cases. We've also closed 3,368 cases as of this afternoon with 932 cases. So that's significant because our work between the investigation for beginning to end with our follow-up phone calls, contacts with the health departments, communicating with individuals, follow-up, generally takes anywhere from 2 hours initially, but it generally takes at least 12 to possibly 20 hours per case to do such a thorough job. So that's a pretty significant number if you can imagine the manpower that's went into those 3,368 contact hours. So thank you, John. So that's kind of what that looks like. Next screen, please. So our case reporting has been made uniformly. So, that whole concept of having a one-stop shop for staff and families. So in this case, we're going to go over the staff reporting. So John's logging into, you can see you can just click directly onto our website. There's a link provided there, and he can fill out that report. In this case, if he fills out a report for himself, as soon as he completes that report and enters, I get a notification, the staff contact tracers get the notification, and then in this case, it would be Mr. Sanders. We won't actually do it to him this time, but he would get an automatic email saying that there is a notification that Mr. Heiderscheit was either exposed, identified as a positive, so that immediate notification goes out. Yeah. This is also hooked up to with the same concept. Information is already connected to multi-systems, so all staff's information or student information as far as phone numbers, emergency contacts are automatically identified through this system. So we have that information immediately. Human Resources Department also has tabs in here. And Almost. So submit. Now, if you could just go to your report, please.
Manager report.
Just go to manage.
Okay.
Go to manage and look up John Test, and you can go to the top. You're going to be to the
Actually,
right.
can we hide that? That has a bunch
sorry.
of, please. Thank you.
Yeah. So through that system, and if you scroll down, this is also designed for automation. For instance, if It's automated if there's a positive case. Once a positive case has been identified, it automatically sends an alert to either the supervisor or to the site, the administrator from that site, to notify them immediately there's a positive. Mr. Heiderscheid and his team gets it, and so does our communication department, and they know to work immediately to get communication if it's appropriate for that information to be communicated immediately if there's been a risk for potential exposure. So again, really working to identify cases quickly and to get that information out as quickly as possible. Next slide, please. So you can kind of see we keep trends of the case reports. Early on, you can see that through March, our case reports were low. As we moved through the summer, they gained. And then we had our huge spikes following our Halloween era in early November with the huge landscape of what looks like Manhattan now. And I just want to say a thank you to the district and a thank you to all our staff who spent many, many hours, especially during that time. And unfortunately, we're working 7 days a week to manage those volumes. Next slide, please.
Mr. Judge, can we go back to that real quickly?
Sure.
So just to make it clear that even though we're taking in these reports, it's while people predominantly have been working remotely for teaching staff, most of the school buildings have been relatively empty. And students not in attendance except for circumstances back when we had kids in for specialized student services in the second quarter and pre-K to second for a period of time. So most of these are not cases that are within school. These are not school building based cases. These are typically, as you look through the reports, what's the common?
Yeah, correct. I mean, most of these, we contact trace for all with the potential that, of course, we want to provide support for those who could potentially be coming into our buildings. And of course, we want to provide support for our families so that when staff or students can return, that we're ready and available, and that everyone, we've assured that they've had the testing, the education, and they are cleared and safe to come back in. So yes, most of those reports are for those working remotely. It is varied. It's not differentiated from in-person to remote, so that it is a mixture of both. So
The high percentage is because we do the reports, so the high percentage is that they're at home. They're reporting their symptoms, so their principal knows what's happening, and they're getting information to the school, which is great. That's what we need to happen.
Yeah, I just wanted to point out, because as I've talked to the county, and I know Mr. Judge, as you've talked to the county, most of the time, most school systems have not seen significant increases in COVID cases when they are open. It typically comes more from a community spread, which is what you're seeing. Most of this would be considered community spread. Actually, all of this would be considered community spread.
Yes.
Correct. Our numbers mirror, if you look at the county reports and our case reports, the spikes are almost identical. They're a mirror image of each other. The other significant piece of that is that most exposures happen within more intimate setting, especially home, when people are obviously less concerned about social distancing and mask use and that kind of thing. So the health departments have continued to report that most exposures occur at home. That has been more than true in our findings as well. Most of our exposures that are reported is because someone residing in their home is tested positive, and that's the source of their report. Of course, we still handle that as anything else because we want to mitigate the spread of COVID. But very good point. Thank you. So, like I said, the reporting system has a built-in automatic alert system, so it does notify the supervisor. If it's staff, if it's a student, it notifies the building administrator and the nurse at the same time, so they immediately start following up. Our initial goal and what we've finally been able to achieve with all the additional staff is that initial contact is within 24 hours or day one, depending on when that report comes in. And by that, usually we're starting to follow up with close contacts. Even if we don't start, if it's the late or end of the day, we have a process in place. So, administrators are now trained if they get a report, even if it's at midnight, that if they get their report, to reach out immediately to that individual and say, please, you need to remain home until a contact tracer contacts you. So students, we've obviously had to prioritize. the difference between in-person and remote learners. Our priority is in-person if students are attending because we want to mitigate exposure. And we've also had to take in consideration all this additional programming needs, such as Boys and Girls Club, right at school programs, to include those students. So we've kept very close track and monitoring on that. Our goal has been, and we continue to monitor close contacts and identify them quickly. And again, we try to get to that within 24 hours or 1 day. We literally follow to the letter the IDPH COVID-19 exclusion guidance. Per the Department of Public Health, we continue to use the 14-day quarantine rule, which is the recommendations by the CDC, even though there is a new abbreviated period that can be used in some areas if allowed to by the Department of Public Health, but we are going conservative and we're only using the 14-day. We still continue to identify close contacts within 6 foot or 15 cumulative minute rule. And we have that process put in place for identification and notification of positive cases. So one of the things that Mr. Heiderscheid was discussing was our cleaning request. We actually implemented this cleaning system a number of years ago, which was new for School District U46 with our specialized cleaning. So now we have not only regular cleaning protocols, but now we have established cleaning protocols for infection control. And this originally applied to flu season. It could be chickenpox, measles, whatever infectious disease, so that we can work collaboratively with the cleaning crews to make sure that they're safe and we're safely cleaning. But we continue to use this through the pandemic as we've transitioned from every classroom where students are receiving deep cleaning. Now this process still continues for things that would be kind of off that program, which would be individual offices or areas if staff members have been identified. So we still have the process and all administrators are trained and use it and are very familiar with it. So it's been a very successful program. So making sure that we don't miss a single office or area if it needs to be cleaned because of COVID. So vaccination just begun. So the multi-tier level of vaccination that was established through the State of Illinois vaccination plan. So currently we're in tier 1A, which is healthcare personnel. This has been a really interesting process, for our nation and world getting all these vaccinations out. There's still a few bumps, but we're blessed and fortunate to have this vaccine and its rollout. So right now, school nurses and originally it was occupational and physical therapists were allowed to be in the 1A. And I'm very proud to say personally, I just got my second vaccination on Saturday. So symptom-free, no problems. I'm living proof that you can get vaccinated. So and then the next step will be the 1B tier, which will be the school personnel. You can see we still have a long way to go in this rollout, and we're working with our health departments. We can talk about that in the next slide, John. Thank you. So again, with these vaccinations, things continue to change a little bit. In Group 1A, they've now not only added nurses, physical, occupational, but they've also added speech therapists, which we're working with that department as well to get those vaccinations available to them. So all 3 counties, Kane, Cook, and DuPage, are providing vaccines as they are available. We're also working to partner with Greater Elgin Family Care Center, the VNA. I've been in contact with them for options for upcoming 1B category vaccinations. Walgreens has been approved, as you know, that's been early on, that was established by the federal government that Walgreens and CVS would be providers of the vaccination. Walgreens is currently doing the 1A vaccination and 1B combo, so they'll be offering those vaccinations. CVS has only been approved to give the 1B vaccination, so that'll be starting with the next group. As far as student community vaccinations, the county public health sites all have information, and you can go to the website. They have areas you can sign up for. You can receive their information, their emails, and they can notify you when you would be eligible to receive your vaccination, no matter what category or tier you are in.
And then we're both coordinating with the counties as well, and have had conversations about rolling out within our school system as well for our employees.
We're looking at every possible option we can to make vaccination easy and readily available, not only for our employees, but our community as well. You know, the state of Illinois has already been rolling out some initiative with the use of the National Guard. So we're exploring how options we can collaborate with that. I've been meeting with Greater Elgin and the VNA to see what they can offer us and how we can best serve our community and our staff. Again, we're working with CVS, working with Walgreens to see what programs we can offer and how we can best roll out these vaccines to everyone. We're looking at every possible scenario where we can partner and streamline this, because, you know, I'm hoping that through the chaos of 1A, and I understand, you know, this literally is something that's never been done before. So of course there's a little bit of hiccups in there. By the time we get to 1B or the next staff, that will have smoothed over some of the bumps and make it a little bit easier for everyone. The other big thing that's kind of exciting that we're rolling out is rapid testing at U46 facilities. So we're working with the county health departments. There is a rapid test. This test would be used for those that were symptomatic with symptoms of COVID to identify positives, or those that have been exposed to confirmed positive cases. So we're still in the process. We filed our CLIA waivers. I've been working with the health departments. It's going very well. And we'll see what the logistics of how this really rolls out, but I think it's going to be something that will happen rather quickly. So the rapid testing is the Abbott's Bionex Now testing, which is about 97% accurate. The results are usually result in 15 minutes. So that means we can place individuals that test positive under the quarantine immediately. So that's quick identification for positives. Individuals that will test negative would still be considered under quarantine. It would still have to follow IDPH rules for quarantine. So really the purpose of this is to identify those positives so that they can seek treatment and be quarantined as quickly as possible. This would be at no cost to any staff or student member. This would be a completely free service. And the number of tests which we receive would be based on the countywide need for testing. But I did speak with the health department today, and they indicated they would be quite generous with the testing materials. So pretty excited on that. So personal protective equipment training for staff has been completely ongoing through the pandemic. Our clarification of PPE type and what it's intended use for. I know that's a kind of a small version, but unfortunately there was no one-stop shop for best recommendations for PPE specifically for schools and all the different situations we run in. So a collaborative effort was put together, and we combined the conservative approaches from the Centers for Disease Control and Prevention, IDPH, and the National Association for School Nurses, all the recommendations, compiled the most conservative recommendations, and that's what we have been using. That's the model we've been using, the most conservative that we could follow. We've been providing education on PPE use, when to use it, how to use it, how to reuse it, conservation, and even how to order supplies. You know, we're still maintaining a pretty conservative approach because, you know, PPE supplies and ordering was limited, and for a while there was a major problem for the entire world. And we just want to be sure that no matter which way this pandemic turns it, we are prepared and always have enough supplies for our staff. So we want to be mindful, not wasteful. We want it to be available, but we also want to be respectful that this conservation is not only for us, it's for our students and for our community, because at one point during the pandemic, you know, we were having to share our PPE with our fire departments, with our hospitals, because they didn't have anything to take care of our families. Or so, you know, we want to be mindful of that we may be in that position as well. So we developed a PPE donning and doffing procedure, or applying and removing PPE, which we've shared with all the staff. And more importantly, we've offered in-building, and we will continue offering in-building support from our certified school nurses for a consultation on PPE storage, usage, and application, and even go through practice sessions with them. So one of the things we use to monitor our PPE understanding at the buildings with this whole change in thought process with centralized ordering. So each building has a designated PPE person who is targeted to monitor and order PPE. So on the left, the PPE distributed is so far what we've distributed, 2 buildings, 2 data of just a few days ago. So you can see that, small gloves, we've already sent out 13,100 small gloves. I mean, you can go down the list and see the amount of face masks, like 116,700 face masks. I mean, we have sent out a large number of supplies. The PPE stock on the right is what's still available. I work with distribution, and we work collaboratively to monitor and make sure that everybody's ordering, they know how to order, that someone's monitoring from each building, and that we're monitoring supplies and availability, because things wax and wane as far as availability, because sometimes there's a great supply out there, and we try to be conscientious of that and also plan ahead if we think something's going to be low in stock again. So, and just kind of a final summary. So, our PPE supplies, we have it. I still implore everyone to be conscientious, be conservative. I don't know, what's going to happen, and no one really does, but we want to be prepared for all, but our district was very fortunate. My department started stockpiling PPE in December when the first cases, like literally my office was filled with PPE, which we used while we were in search to float the district, and not only our district, but our local fire departments, some of our local clinics, and some of our hospitals. So we're very fortunate that the district allowed me to do that in that plan. So thank you for that flexibility. We worked very hard to distribute medications early on when families weren't understanding that this is probably not going to be a 2 to 3 week event. Trying to get those medications out there to students who needed their inhalers, their diabetic strips, all their medications when people were scared to pick them up. We've established a whole new department on contact tracing, which I'm proud to say, working with other districts in our area and state, is truly far superior than anything other districts are really offering at this time. So working to monitor compliance and with staff and student self-certification. And our nurses have been available in building, on site, being available for staff questioning, working with them, being available so that families have a one shop the place to call so they can contact their nurse, ask questions, get information, and they're always available at that number. So they're not working from home, they're in building, working for our families. And on a side note, our health services office here at the main office has been open and running for all but one business day, which I work from home through this entire pandemic. It has never closed. It has always been open, even on that one day, even during the mandated stay home order. Our staff has lived beyond their job descriptions. They have not said, this isn't in my job description. They continually come to me and say, what more can we do? So we are definitely here for you. We're here for the district as a whole. We're just waiting for the next adventure, the next thing we can do, like the Bionex, like the testing. How can we help and what can we do? Because we don't believe at this time any of us should be looking at our job descriptions. We should be looking at what we can do as a community and a district. So thank you for that flexibility and that understanding.
No, the health services team deserves really a lot of our applause and certainly our appreciation for all their hard work. It's been amazing.
Thank you.
And to close on the next 3 slides, we promise the data monitoring that we started was from Illinois Department of Public Health, immediately from them. And then we developed, as the Illinois Department of Public Health developed better metrics and better things that we could see, we drove in deeper to their metrics. So the zip code information is from the Illinois Department of Public Health. on their COVID websites for mitigation for schools. They also go into hospitalizations, and they go to different metrics that you can see deeper. They give the 4 metrics that are involve total count, new cases, your positivity rates, and your youth counts. And so we've been tracking this. This is actually a larger spreadsheet. What I noticed right away was they were having a matrix that it was red if this was orange for 2 weeks, and if this stayed blue and went to orange so what we did is we created a timeline. So this timeline actually goes back. Every one of our daily situational updates, we date all the way back in the same Excel spreadsheet, or Google Sheets, I mean. And this, the data surveillance chart, we have one for every week. So we can go back and look at where we were, look at where we're going, look at what's happening now. We're not here to assess trends. We're here to monitor the trends and make decisions based on further mitigation techniques. So that's where we've been, and those are the data that we're using. It's all from the Illinois Department of Public Health. A couple of different pictures from schools. We grabbed a couple with our intern walks around the buildings to do some observations. You could see floor markings, toilets or urinals taped off, cleaning supplies on tables, and different signs posted. We'd have many more, just too much to show. And then really pulling this into our continuum of layers of support. What we're talking about tonight is our universal. And we've given you some information about our tier 2 for some suspected cases and what we can do. I can tell you that and I've had 2 situations of exposure in my home. So I was on quarantine twice. That didn't affect me. I had a test, but I would tell you that the nurses that call, they go through everything with you. Our staff, they go through they're at our service. I was like, why are you talking to me so long? Get to the next case. Tier 3 for a few cases, confirmed positive cases, and we've shown you that data, that we're tracking that and monitoring that. We've collaborated on these information to what I believe pretty well. And finally, I would tell you that we should start with safety first. All leaders start with safety first, and that's where we are. Procedures are in place, and they're ready for if there are new changes from IDPH or whatever that might be. We are positioned to do that and to then have training sessions the next week with all of our administrators. And we will be continuing our collaborative teams with our Safety Operational Subcommittee, our Safety Council. We have meetings scheduled through spring break right now, and those will be completed for the rest of the year, probably in the next couple of weeks. And our community agencies, early on, Elgin, the city of Elgin had a Sunday collaborative of all their resources, and we were part of that team. So we were talking to each other. We're working with our fire departments. We have our safety task force meeting this week on Wednesday. So we want to keep this in the forefront, and it is everybody's concern, and using same language, NIMS, and all those pieces to keep us on the same pages. So with that, we'll conclude our formal report, and we're available for any questions that you may have.
So just to wrap it up, I know it's been an hour and 15 minutes, and I did typically we try to keep these to 20 minutes, but I can't keep John and Jeff to 20 minutes. Just to bring it home real quick, I want to thank again the entire team. We wanted to make sure that we answered as many questions as we could before you even had questions to ask. That way we were as comprehensive as we possibly could be. I can tell you, working with superintendents at the state level through the state transition team, working with superintendents across Kane and DuPage counties, we have a really solid plan. We didn't just build this plan, though, on our own. This was not just John building a plan or Jeff Judge building a plan. This was a collaborative effort with the Elgin Teachers Association, with our support unions, with members of our community. The board has received multiple updates from administration on our return to learn plans, from the different models that we would be utilizing, and now all the way through to our school safety and security and how we're going to make sure we protect students and staff. I just want to reiterate that we did this collaboratively. We didn't just do this to people, we did it with people, and as we developed all of our plans, which is unlike many of the districts around us that have already reopened. I would like to just point out in closing that we've tried to keep true to our promise to the board and our community. When we opened up and made the decision in July to continue forward in remote learning for the first quarter for elementary, and for the first semester for secondary. That's what we said we would do, and we've kept true to that. We were able to bring back some small groups of students back in second quarter. In fact, at a time when our metrics at that time were higher than they are right now. We were able to do that for 2 weeks for pre-K to second grade and about a month for specialized student services. We intend to continue to keep our commitment to secondary to bring them in beginning later the second semester on the 19th. And it would not be possible without the folks sitting here and all the committee members who served to provide support throughout the last several months to get to this point. So with that, thank you for letting me interject at the end there, John.
Absolutely, sir.
Okay, do board members have questions? No? Melissa?
So first of all, I just want to thank both of you for in your departments and everybody that you're working with for all of the work you've done. I work for a much smaller organization, and I see the man hours that have to go into what it takes to keep our staff safe. So I multiply that by hundreds, right? And so what you guys have done is just incredible. So thank you for that, especially as I look toward my own son going back to school in a couple weeks. I appreciate everything that you all are doing. I did send a lot of questions before the board meeting. Those have been answered. I thank you for that. Just to clarify a couple things. And let me think about how I want to do this. So I want to go back to the mask issue with students that might be refusing to wear masks. I appreciate the discussion that you're having about empowering staff members to let other staff members know that they're feeling uncomfortable, and giving people those words and that language to use. Again, this is exactly the same thing that we are doing in my organization as we all return back to more or less full-time work in the building. As far as students go, can you walk me through again what it actually looks like? Because I know you had it on the screen, but if I'm a staff member and a student has walked in and they are refusing to wear a mask, what does that immediately look like?
So can you put on your mask, please?
No.
No. Well, when you put on your mask, then you can come in my classroom.
And so, and I guess my question is what happens at that point
So
if the student continues to refuse?
Exactly.
Okay, so no, I don't want to put my mask on.
And so there should be a first attempt by any teacher or staff member to then intervene, because there's a student facing a challenging situation. We might not know there might be something else to it.
Right.
So in that continued refusal of putting their mask on, that's an immediate call to the administrator, whether that's an elementary or principal, whether that's a secondary or a middle school, an assistant principal, or the dean and the high school. So that's an immediate call, because we're basically telling that's an unsafe action. Mm-hmm. Now, one thing to keep in mind is that all staff should recognize, and all of us should recognize, maintaining 6 feet at that point of distance is always the thing. So you may want to take a step further back. Because like in CPI training, when I take a step back, it communicates respect. It also sends a message that I'm uncomfortable, and tell the person you're making me uncomfortable. To be back in school, all guardians should know that we have to wear masks. We want your children to maintain 6 feet at all times and be ready to wash your hands often. And those are the expectations to come back to school. So and if the student refuses and continues to refuse, whatever that might be, call the administrator. The administrator will be immediately responding, getting down to that as soon as possible. The staff member can ask the student to wait out in the hallway. If the student then would come in and refuse and then start walking around and evacuate the classroom, just like I liken it to an escalation.
Okay.
So if a student had an escalation and it was something that isn't pandemic related, what would we do in that escalation? Well, then that would be a classroom clearing. Let's move everybody out. There should be a pre-designated location in every building, which is typically right now the library, because the libraries are not being used widely. And there's a staff member there. And we can move the kids who are not involved with this to the library and spread out.
Okay.
And then the administrator should manage the situation. There's a possibility that there could be a suspension, but we want to use progressive actions, just like we would with employees who might refuse progressive actions to try to gain their compliance in the rules and that. And Robin and I have discussed that if those situations get to the level where the administration of the school needs assistance, could there be a placement? And we're considering placement to be if that would be a move to from in-person because their parents want them in person, and if that would be a placement then to either remote or to something else. That would go through our normal process, through our normal assistant superintendents. So we would follow that system entirely. Now, that does not necessarily include students with IEPs who may have more challenges of those situations. Like our student code of conduct, our student code of conduct applies to all students. But students with IEPs, the interventions would be matching their individual education plans. So that would be a little bit different. We would involve a special ed administrator and how we would move forward with that situation.
Okay, and I appreciate that. It's one thing to see it on the screen, right? And another thing to walk through it. And the reason why I asked that is throughout all of this, I'm trying to also put myself in the position of what it looks like to be a student or a staff member, just like, the experience that I'm going through at work. And for me, my comfort level is making sure that everybody has a mask and is socially distanced because that's our best chance at maintaining health, right?
Right.
And so, I just wanted to be clear as to what that process would look like. Because I would be uncomfortable if I was in a room full of people that did not have masks on, whether or not we're, appropriately spaced. That still makes me uncomfortable. So I just wanted to see what that looked like.
Excellent.
I appreciate the discussion on the metrics. I know that this is a discussion that that we've had a lot, and I know that we've gotten a lot of feedback on how the way that we've looked at metrics seems to look like it's shifted a little bit, and as we've gone through this pandemic. And again, I think we've experienced that where I work as well, where we've had to kind of recalibrate how we look at what the disease spread looks like in the community, because it's different now than it was back from what our thinking was in April and May, right?
Absolutely.
I guess my question is, and I know that we are in close communication with the county health departments. We're watching the data that comes in from IDPH. If we take something like contact tracing, and so, I appreciate knowing how many man hours go into contact tracing, right? So we've got 500 and some open cases. So we're looking at close to 1,000 man hours, right? To clear out those cases that we have right now. So if there was more community spread, that most likely means that our open cases are going to go up because our open cases mirror what's happening in the community, correct?
Correct.
So like at what point do some of these things start pressing in on us so much that we have to start thinking again about pulling back from in-person learning? Or are we not concerned about that at this point?
Yeah. So if you don't mind, I'll take the lead, and then if Jeff or John want to weigh in, certainly they can do so. What we can rely upon is what the experience of other districts was. Districts that have gone before us and have reopened, and in most instances, they were able to keep their doors open. The challenges had been, again, contact tracing. So if you have a large number of staff who are quarantined, that can cause you problems. And of course, if you have an outbreak in a school, which luckily at least in the surrounding area, there's not been a lot of outbreaks in schools. So I think the approach that we would prefer to take, and I wrote about this in our weekly message, and it aligns with our emergency closing procedures, is if we have to close, it'd be better to close site by site based on need. If we have a significant number of staff at a site that become ill or students who become ill, do it site by site rather than closing 57 different buildings and programs. And so I think that would really be the more reasoned approach, is just identifying when we have issues at a particular site and making that site, much like we would during any other when we had H1N1. We had Ridge Circle, Larkin, and one other site that the county health departments recommended we close. And it worked very well just to do it site by site. And I don't know if you want to add anything more.
Yeah, and we are literally, our department talks to the counties every day because we've become so proficient in contact tracing. We're the only district in the state that has a centralized contact tracing for the school district, for any school district. We're at for the state. We work with the contact tracing team. We work with the epidemiologists every single day. So we're aware of those trends of what's going on or what we think is happening. So, and then Mr. Sanders and I meet at this point twice a week to kind of keep track of what's going on, what the possible warnings are, any trends, so that we can communicate with the health department. Because clearly you're right that the number of cases mirrors, is it a warning for where we should be going or, yeah.
And I'd be remiss if I didn't note that our Human Resources Department also monitors attendance on a daily basis as well. And so if we're running into issues with staffing a building, then they certainly would make me aware of that every morning.
And absolutely, the data matters. We monitor it, but it matters for mitigation and doing more mitigation. And that more mitigation could mean closing a building for a period of time and returning back to some kind of remote learning. But would take that on. We have the data to do that case by case, as you've seen in our own reporting. We can see that. And we created kind of a tier of checks and balances. So my department pushes the notifications when that comes, and we question that and to check that and to check their team, and his team checks our team. So we created checks and balances within ourselves to monitor the data. And then every Monday we're watching the data, and every daily we do a daily situational update that also has the percentage of positivity rates and other rates in that to inform the organization of administrators.
And I know that before, I keep wanting to say last semester, but we're still in the first semester, until the end of this week. But back in the fall when we were, we were working with all of the health departments on the plan to go back to school. We are still going through that process, correct? That we are collaborating with the health departments.
Yep. I met with both Kane and DuPage today. In fact, 1 o'clock with Kane County, 2 o'clock with DuPage.
Okay.
So absolutely. So they both know that our health departments know our plans. They support our reopening plans. Now DuPage is a little bit more cautious, but they do defer to our judgment. And if you look locally at our zip code data, which I shared with you, we are even though in our county, our numbers are higher, within our zip codes in U46, we are not even as high as what our county would be at this time.
Okay. All right. Thank you. I'll let other questions.
So this is Eva. I have a question. Thank you, Brian and Jeff, for a great presentation. I had a series of questions as well, but they were all answered. But even today and for the past week and even for the past month, we have been inundated with emails with questions from teachers and addressing the health and safety issue. So tell me, what in the in-services that was offered to educators, was this the type of presentation that was given to them? Because some of the questions, had they seen what I seen tonight, a lot of the questions would have been answered. I know a lot of times in a presentation, you still have other questions, but I mean, you basically hit every question that I received from teachers about health and safety in the classroom and et cetera. So would you tell me, how was this rolled out to the teachers in their in-service?
Thank you for the question. This presentation was actually built from the staff presentation that Jeff and I do for each staff that are rolling back in. So as that presentation was built out, we went into a deeper level with the board presentation about the collaboration and about the procedural aspects and not necessarily the day-to-day. So I believe that our presentation was really streamlined on the day-to-day safety pieces, coming into the building, fobbing in, the procedures about resistance to PPE. So we definitely laid that out, and Jeff went to a lot greater detail about PPE and other aspects of his presentation, but was not at the depth of the depth of this presentation. But the other side of that is that all these folks have not, most of these folks have not been in a building since March. And when they get back in the building, they'll see it firsthand. And sometimes when you hear it, when you're listening to a presentation, you get what you get out of it, and then you actually go hands-on and you see the building. That's one of the main points about asking staff to come back a week early and getting them into the building so they can see the things that we have, address their concerns to their supervisor and to their administrator, to know that their administrator is very likely prepared to answer those questions and to address those situations. So, two, we want to match those gaps wherever they are. But the presentation started with the original staff presentation, and then we went deeper as we were hearing more concerns as we were approaching the data open.
I think there's a few things that were not included in the training as well because we didn't have them in place yet. So the testing component, we had not announced the Buy Next Now test to staff at the time because we were not close enough. We weren't even sure yet whether or not we would be in the running for the state pilot. The self-certification also is an area where I know the ETA raised concerns, and we tried to be as responsive as we could through changing our processes. So there are some other areas that at the time of the presentation, it would have been a different message than what it was tonight because we have changed our processes in a few areas.
Yeah, absolutely. And most notably is the changes that were made just in the past week on self-certify, that we're going to take a stronger approach to students who are not self-certified by their guardians and have a check and assessment by the nurse. That was not meted out until this last few weeks. As we had the impression that what we had planned was on it, and then we heard through a collaboration or through the reports back from ETA leadership and other leadership that, hey, they just don't feel comfortable enough. So we built in a deeper level process.
So thank you so much. So the type of questions that I had, I pretty much took from more than one email that I received so that I could kind of see that it wasn't just one person's situation. But when I hear that, say a teacher has gone back into the building and they still see that their classroom, 15 desks are not 6 feet apart, or they feel that the cleaning hasn't taken place like it should be. And then whenever I get an email where several teachers are saying they are afraid, they're frustrated, and they feel like they have not been heard. And so this presentation tonight, I understand having educators back into the building prior to so that they will be knowledgeable of what we just received tonight. When will they get what we got tonight if they're not on the school board meeting tonight? When will they get this presentation? Because they'll be in the classroom teaching so that they know how to go to the different services that we as U46 have provided for health and safety, and know that these are things that they can retrieve so they will be knowledgeable and educated.
I think that's a great question. I think that even though during the pandemic, things have continued to change on a pretty regular basis. So the training we have been providing has been following that timeline with as things are discovered, as information is shared. The one thing that's been 100% consistent though, is the development and the transparency of where to find the information. The pandemic procedures, the webpage is always live. It's always up to date and always available 24 hours a day to staff. And that's the one message that's been clear and very self-evident that we've been promoting. John Heiderscheid has been excellent about making sure it's maintained. So that information is always out there and available. So as far as that question, I think that's a great question. And I think a chance to really promote the fact that any staff can go on, find the information, find the links, and find the procedures 24 hours a day. 7 days a week available in there. What we're teaching is always on that site and always available for staff. So, John, do you agree or have any comments?
Yeah, the only thing I would add is that when folks come back in the buildings, we're asking to redo the scenarios, redo the walkthroughs with your school department committee. They take their concerns to their principals, bring their concerns to their administration, because that's who's best going to be able to answer that question. We have a bit of a culture in the organization where we do kind of a workaround. We tell somebody who tells somebody who tells somebody who tells somebody, and we're really encouraging a different culture in the organization where, you know, go directly to the source, and that's in your building. And our work now is to develop our leaders in this realm of pandemic safety, so they're in depth and they have knowledge, something that they're farther away from. And when they feel challenged by a question or they're not ready for that question, as they have resources available to them. The chain of command, if you will, is get back to your administrator, your supervisor, and see if they have the questions. And if you're still not satisfied with that, be sure that your supervisor knows that. Be sure that your administrator knows that, so they can pass that back to us. There's no judgment in that. Nobody's going to get in trouble. We're going to use a growth mindset to use that feedback to improve our practice.
Thank you.
John, this is Bruce. I'd like to address Eva Porter's question about the desk.
Yeah, go ahead, Bruce.
Ms. Porter, so every principal is given the latitude of how to handle or set up their room, but rest assured that if they have available space, they can keep the desks all the 6 feet apart. But if they don't have available space, what we have provided them with is a green check mark that they can place on every other desk to make sure that they have that spacing.
Thank you. So I have a question. So what happens to the other desks? Because I did have an email today that said there were desks in the hallway, and they thought that it was going to cause congestion in the hallway and not the safest thing to do. Now, that was just one email that I received that person said that.
We definitely won't allow the desks to stay in the hallway. We'll work with the buildings if they don't have space available and make sure that the hallways are not congested.
And something we collaborated on, or at least I remember having conversations collectively on, and maybe it was not a conversation or it was just a question and answer. But we don't have all the storage space in the world to take all these desks out of each classroom to only have the proper amount. That's where the green check mark came from. And I do remember that we had discussions on a solution to that, to have that green check mark. Now, did that information get to that teacher or that staff member? Was it given to them 6 months ago and they forgot? You know, there's a lot of things at play here about coming back and getting our feet in the water this week and into next week. But ultimately, we can't take every single desk and piece of furniture out of a room. We don't have the place to put it. We just don't have the place to store it. But we did develop this green checkmark plan. Thanks, Bruce, for reminding us and to bring it forward the best we can. So then when we hear that we have desks in the hallway, we're going to work towards that and point us towards those things to help folks make better decisions and use that feedback to improve our practice.
And John, if I may add, this is Sheila. Ms. Porter, we also created a socially distant building configuration where we provided each building administrator with diagrams for how classrooms should be set up. Building administrators were also, several of them emailed where they were run into roadblocks, and we would send out plant operations staff to set up classrooms side by side with the administrators. Custodians were also trained and they've been also assisting. So I'm not sure about that specific incident where there were desks in the hallway, but that has never been the direction of the district. So I know we had one building where they could not stack the desk appropriately, or the green check marks didn't work in those particular instances. And I know business services has done a really good job of accommodating those particular buildings and moving furniture out of the classroom if needed. However, most buildings have been able to utilize the space within the classroom and use the green check marks or reposition the desks. So I'll definitely have all custodians walk all classrooms again tomorrow to make sure that all classrooms are set up appropriately.
Thank you. I know you have done a wonderful job. Thank you so much.
My team and I appreciate that. Thank you.
Other questions? Veronica?
I actually had two questions. One of them you pretty much answered already, but I want to reiterate it because I want to make sure that we draw attention to what Mr. Heiderscheit said and Mr. Sanders regarding the culture that we need of being able to communicate with our teachers, between teachers to their principals or their administrators, and not to have judgment and have this learning environment, because I am hearing from different teachers the idea that they don't feel comfortable bringing forward their concerns, or that they feel that their school, different schools are handling the instruction from the district in different ways, some with fidelity and some without. And, I reiterate that they need to bring this forward up that chain of command that you mentioned. So I want to just reiterate what I heard, which is that there will be no judgment, that they do have the ability to speak freely regarding these concerns that they have, and should be able to communicate with their administrator, their principal, and if they don't get a resolution, be able to go up higher. I mean, I want to correct me if I'm wrong there. So is that correct?
You are absolutely correct. And I'm really hoping that, as Tony has said many times, if we don't learn something from this crisis and this event that teaches us something, this teaches us. Crisis doesn't make us, it reveals us sometimes, and this is revealing us. And we consistently repeat this theme when we have to state this as leadership, is that it's okay for our employees to tell us, it's okay for our staff, the people that we work with, that they feel uncomfortable. Bring the information forward. And if you need to retrain them, retrain them. If you need to point them to a procedure, point them to a procedure. That was the idea behind the intranet and staying as transparent as possible.
Thank you. And then the other one had to do with some teachers' concerns who have talked to me regarding some folks teachers who may not self-certify with fidelity because of a concern that they can't financially take any more, so they don't have extra sick days. What will happen if they are quarantined for 14 days and they don't have enough time off? That comes up a lot. And so I want to know if you can clarify how they should be handling this.
So that was one of the other changes that we made that was in my weekly message this week, was the federal government did not extend the, and I always mess up the acronym, FCCRA, the leave. Did I get it right, Jeff? FCCRA?
Families First Coronavirus Relief Act. Yeah.
That's it. And so we as a district are honoring that. So that if you have to take a leave, you have to go through the right process, self-certify, talk to your supervisor, go through HR, but we will provide that first round that was provided by the federal government, the first go around. We'll continue to do that through March 31st.
I'm very glad to hear that. So thank you very much.
And I took Tony's message from Friday and I added it into the staff intranet under the accordion to provide that more information so people could have a landing page to find it.
Thank you.
I just want to add something else to the parents and to the teachers, that I am very sensitive to your situation and your issues that you bring forth. Continue to email and continue to do less talk and to continue to educate yourself. I am not answering most of the emails back because they're just way too many, but I am reading them. So continue to speak out and continue to contact us. I would appreciate that. That's the only way I really know how you feel. Thank you.
Kate. Yeah, so I want to say thank you for that extensive everything and all the work everyone's doing. I'm working in the medical setting now, so I know how difficult all of this can be and all of the steps. So just thank you. There's too many people to even begin to name. So I want to say thank you for that. I want to thank you for addressing Melissa's issue about the masks, because that's my issue as well. And so I just want to be really specifically clear. If you have a child during the day who is refusing over and over to put the mask on, you're calling mom and dad. Mom and dad are like, whatever, he doesn't need to wear a mask. Sending that kid home for the day and moving them to distance learning is an option, correct?
Yes, it's a possibility within our student code of conduct. Yes.
I realize you have to express each situation or examine each situation specifically, but I want to be sure that, because I think that's one of the things that teachers are very concerned about. How are they going to deal with that stubborn 16-year-old kid who is going to say it's a beautiful sunny day when it's really raining because they're 16 and stubborn? So, okay, good. I want to be sure that was clear. Yes.
No, I was just going to add that absolutely, but again, that's the upper tier. I mean, that's after you go through several.
I understand.
And I also would note that while I understand it's a fear, it's not really come to fruition, at least in other districts. It's not been a major issue, at least among the superintendents I've spoken to. It just
Yeah.
is not, it's not as big of an obstacle as what I think people perceive it to be, much like people wearing masks around this office building. At first, it was a little bit unusual, but we've gotten into the routine.
Yeah.
And it's just an expectation now. So I think kids will do what we ask them to do,
Yeah. No,
especially if we model the behavior.
Of course. I just wanted to be clear on that. So this presentation was really great, but it's on the executive contact on the board. Is there a way that we can make at least a majority of it available to the public? I understand some of the links and things won't work properly.
Yeah, we absolutely will. Yeah,
Yeah.
It always actually every strategic plan report after it's aired, we roll it up into
Okay.
public content.
Just
So
trying to remember
absolutely.
how all of that worked.
Yep.
Yeah, because I think that the fact, again, that the masks can be escalated up as a behavior is something that will give teachers some comfort to know that. Because even if they never face it, they have a fear that they might.
Yep.
And that's a legitimate fear. When you were doing the emails and you were sick and it was going to Tony, where does it go when it's a student? Does it go to the nurse, to the principal?
Principal.
The principal. Okay.
Yeah, the student items will go to the nurse and the principal. I know it goes to the nurse and the
The
principal.
self-certification, are you talking about the self-certification?
Yes.
Yes, if it's a staff member, it automatically goes to the building administrator. If it's a student,
Yeah.
it goes to the nurse and the building administrator at the same time.
Okay. And then if families have a child who's sick at home, I mean, people are still getting sick and it's not COVID. Do you want them to do the self-certified? Do you want them to just call their child in sick?
Do both.
Do both. Okay.
Cover it both, but they definitely, what we want to happen is not for the self-certify system to take over calling in sick and telling your
Okay.
supervisor. And we don't want it to take over the parent making a contact with the school about the illness, because there likely is going to be additional questions that might be able to be answered quickly, especially if you have siblings in other schools.
Sure. Oh, sure. Of course.
So we want to maintain the call system and the human contact system as much as possible. And so I even said it today in one of our meetings this morning and with Dr. Johnson, is that we can't have the self-certified take over what we've been doing before. This can only supplement what we've done.
Yeah. Well, my other thought too is thinking, I mean, kids are still getting the stomach flu, right?
Mm-hmm.
Kids are still falling and bumping their heads or whatever. So, okay. Those hand washing stations,
Mhm.
are they piped into a water line or are they a tank?
Sheila?
Oh, hi, Sheila. Hi, Ms. Downs.
Good evening. They are a tank. And so the building custodians, they are responsible for filling those tanks. So they're
Okay.
checking them daily and they're making sure that they're full. But they are tanks underneath each of the sinks.
Okay. And how many hand washings do we think that they'll cover? Is it vary by model?
There are two different types of sinks. I don't have that information offhand. Bruce, I know the distribution center, they order them. If we don't have that information, we can absolutely get that for you. But they are lasting for several days. However, we do empty them more after 3 days, just because we don't want the same water to sit.
Yeah.
But they are lasting for several days. Obviously, the buildings are going to increase occupancy, so we'll check them more regularly to see, depending on the area, there may be higher usage in some areas than others. So it will vary based on location and by use. However, we are checking them and we'll start to determine what the norms are for each of them going forward.
And so then if the teacher discovers that needs to be filled, like a little kid left the water on and it's running, they can go into that system and click and say, hey, this one is empty or it's leaking or whatever, right?
So similar to other work order requests, they can simply stop by the secretary and the secretary can either enter a work order or they can radio it directly to the building custodian who will take care of it in real time.
Awesome. Okay, thank you. I can see a first grader accidentally forgetting to turn
And
the
if you-
water off.
If you'd like to see one, we actually have them. I mean, there's some in this building. If the
Okay,
board would
yeah.
like to see at least one of the models that's
Yeah.
out there, they're
Well,
pretty cool.
And I was excited to see that someone thought I had two and made sure they had the one small enough for the smaller kids. And then in terms of the contact tracing, once we get the, like, whatever, I'm not sure exactly what you call it, but where you say, okay, we now need to call these people, like how long is that taking? Are we,
It varies for the number of cases, of course.
okay,
But right now we're at a 24-hour or less model.
okay,
Because obviously the whole goal is to mitigate, to
Yeah.
identify those that are truly close contacts, which would be within 6 feet or less for a 15-minute period,
Okay.
cumulative over 24
Yeah.
hours.
So we're not behind, so to speak.
We're not behind, but quite honestly, during the month of November, we were 2 weeks ahead of IDPH because IDPH was 4 to 6 weeks behind contacting people. So we were several weeks behind, but so yes, the world was behind during that period. We
Yeah.
were definitely behind, but we were still ahead even of our county health
Okay.
departments.
Yeah.
They were calling us daily instead of us calling them to get our numbers and information because our team was so on top of it. So it is definitely dependent on the number of cases because we can only plan so far ahead.
Yeah, yeah. And then just one last thing, those GCN videos, what does GCN stand for?
Global Compliance Network. It's a national, it's a firm that most districts subscribe to that gives you video content like PowerPoints.
Sure.
And at the end, you take a quiz. And if you pass the quiz, then
Okay.
you're in compliance.
Okay.
So it's most of the modules for bloodborne pathogens, sexual harassment
Yep,
training
yep. I've done
is
those.
done there.
Okay.
Yeah.
Is it possible that as board members, we can see some of the COVID-related videos that you've done or?
Yeah. They're all based on CDC videos. So we'd be glad to share.
Yeah.
We can provide the links to them to the board if that's okay.
I could do it now. We could make this. No, I'm sorry.
No. You're a good guy, John.
But then they have to pass the quiz. So
And then one last thing, is there any plans from the district to make the vaccine mandatory?
Per the United States government, the vaccine is not mandatory.
Okay.
So I don't think we don't have any purview to mandate it or not. So.
All right. Thank you. Thank you. I appreciate it. And again, I don't know that we could ever begin to thank everyone for all of the hard work that they've done. And frankly, our families too, the students, teachers, staff, just blown away by how much work everyone has done. And it's greatly appreciated. And we see everybody. Teachers are amazing. We have the best teachers anywhere,
Yes.
hands down.
Olivia?
Yeah, this is Olivia here. I just have a quick question for the screening questions. I can see it, as this goes on the line, as we get farther, down the line, and these screening questions become more and more, we're doing them every day. I have a fear that they would become monotonous and people would just click no, 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 and not really think about the questions that they have to be answering. Would it be a possible consideration to every so often change the wording of those questions so that people have to read them, again and again to make sure that they're actually answering the questions correctly every single time and thinking about the questions that they have to answer?
Yeah, I think that's a great suggestion and question. The questions themselves are actually based on the questions required by IDPH. So that's kind of the reasoning behind the questions. We can certainly consider like varying the order of the questions, but those questions are based on the IDPH exclusion criteria guidance and their recommendations. So we could certainly put thought into the wording, but we'd have to still continue the main message of the information we would want to get. And I totally agree with what you're saying, but I think there's also a positive to that is we're reading that questions every single day. That's a constant reinforcement every day as well. So it becomes a commonplace in our own lives. Just as John said with our mask use, at the beginning of the pandemic, we were very uncomfortable with masks. And now for me, it's like a seatbelt. I wouldn't think of leaving my house. As a matter of fact, I'm scrambling because, oh my God, I don't have something on my face. So I see a positive in that as well, but we're certainly open to all suggestions that have come to fruition. So we can certainly work on that as well.
Thank you so much.
Thank you for the question.
Anyone else? Dawn?
Well, I had an educational question. Is this the time to ask that question?
I'm sorry, what?
I had an educational question, not a safety or health question.
Sure, go ahead.
Okay. All right. So Dr. Johnson. So on 2 or 3 occasions, I've heard that because we're going back into the hybrid method, that the students that will be in remote, that the teachers are not able to spend time with them. And I was like, the teacher's saying that we will no longer have daily live classes with them. In-person return means even those children who come to the school building will see an increase, but the ones at home will not. And then there's a situation where someone says that 40% of their class is in hybrid, no, in remote. Another says there's in their classroom, and this is supposed to be a regular classroom, where there's only 3 students that decided to return to the hybrid method. So how do we address that type of a situation? Did you follow? I gave you 3 different scenarios.
I think I followed, so I'll certainly make every effort to respond to it. So one, I want to be clear that the numbers of students returning for in-person does look different across grade levels and across sites. And so we will see some variation in the numbers of students returning for the in-person portion of hybrid instruction. And we have certainly worked in areas, and that work is ongoing, especially at the secondary, to be able to address any of those areas where we see a really small number, or certainly the opposite as well, a more, larger number of students returning for in-person. But it is going to look different across the sites. That's why we've also at elementary utilized 2 different models or the 3. So we have in some instances straight sections of distance learning. We had enough students who had identified that they are staying with distance learning, and we had staffing also to be responsive to that. So we have those sections that are straight distance learning sections. At those sites, we also have sections that are all in person. And so all of those students returning for in-person have a teacher for in-person. We then also, though, have a small school model. And so I suspect that a number of these questions come from sites where we have that small school model, where we have teachers who have the responsibilities of both in-person instruction and then also the distance learning instruction piece as well. However, those in-person hours and expectations for what that instruction looks like is the same across those sites. But we do see some variation absolutely between the full distance learning model and then those small school models. My request is certainly that if there are questions or concerns around what minutes look like, resources, access looks like at any of our sites, that you encourage teachers, families to reach out first and foremost to the site. They're the closest to it. They have the most data and information to be able to address that. And then if that question, of course, is not addressed adequately, that we continue, as Mr. Heiderscheit repeated several times tonight, following that organization structure and that org chart until we can address that question or concern. It can be difficult to address it without any of those specifics here. But those are the different staffing models that were utilized to support instruction.
And those are the models that we reached collaboratively, working in collaboration with our transitional learning team, which included the Elgin Teachers Association.
So did the cameras come in for those teachers that are going to be teaching remote as well as, asynchronous and synchronous at the same time? Were they installed?
Sure. So our pre-K2 teachers have received those camera bundles if they identified that they are going to be utilizing them. I do want to emphasize that we have a very small number of teachers who are actually utilizing a concurrent model of instruction. As everyone may or may not likely recall, I should say, we had a lot of these presentations. We actually worked at a scheduling and instructional model that was not going to be reliant and dependent upon a concurrent model of instruction. So even at the elementary level, it's approximately a half an hour each day for those teachers that do have that small school model or have students participating in the in-person and distance learning where they would be utilizing that. Pre-K2, those bundles have been delivered and provided to sites. We've been working through confirming that data with our 3 through 6 site grade levels. Those cameras are in process of being delivered and provided to those teachers. And then we've also been working through all of our data at the secondary level. We do have camera bundles, though, that are on back order. So I'm sure everyone can imagine this is a product that is in high demand across the nation. And so our goal is to have those to our sites and to our teachers by the end of this month at this time. But I also want to emphasize that we continue to monitor that appreciate the collaboration and the assistance from our operations team, Mr. Phelps and his team, and we'll continue to provide those updates to our sites.
Thank you so much.
Other questions? I just had a couple of quick ones. John, you mentioned that you showed on our data dashboard that we show open cases, but open cases could be positive cases, but also people who may have been exposed during quarantine. Is that correct?
Open cases means it's currently under investigation. So it could be positive, negative, symptomatic, non-symptomatic. It simply means we're currently in the process of investigating.
So it could be someone who just is in quarantine because they went to a family party and Aunt Emma came down with COVID.
Yeah.
Okay.
It could be someone under quarantine. It could be someone who's pending testing, who's being recommended testing. So could be a lot of different scenarios where they haven't been identified, and they certainly haven't. If they're closed, that means they've either completed quarantine, completed the process after being identified as positive, or have been ruled out as negative.
Okay.
And you'll also see family, right? So if it's a three students in a household and one member of the household comes down, you could have multiple reports coming out of one household.
Right. Okay. Okay.
Absolutely. And if one student is identified, we currently have a system in place. So if one student is identified, that automatically takes offline the additional students within the district while that investigation is in process. So our reports get very complicated. So it's not just simply one report. It always generates more reports.
Okay. Yeah.
So one report could equal, if it's a family of 3, other students could be 3 additional reports. If there was staff, then, until we identify whether they were close contacts, that could be another additional reports. Up to date, our largest report, one report led to 42 additional reports and 42 investigations. So it's kind of.
And those would all end up under our open cases, just from that one contact.
Yeah. So.
Okay. Okay. Yeah. Have you given any thought to perhaps having an additional column that says verified active cases?
I'm sorry, I didn't.
Have you given any thought about having an additional column on the dashboard that would say these are the cases that have been verified positive COVID?
We do have the positive identity. We have
do.
positive.
Okay.
We have
good.
open, closed, and positive. We try to keep it limited due to confidentiality of staff and students.
Okay. So you don't do it by week. It's just the total positive over the time.
We have a constant update for each school. Each site has open, closed, and positive cases per building, and we also have it per district.
Okay.
And that's updated every 24 hours.
So to take Avid, for example, they have 16 positive cases. That's for the past 2 weeks.
No, that's cumulative since March.
Okay.
Yeah.
So okay.
Yeah, so open and closed positive cases, COVID-19 since March 2020. We thought it was important to show the entire, instead of showing 2 weeks. We thought if we just show 2 weeks, then somebody might be critical and say you're just showing 2 weeks of data, and we didn't want to do that. And then the other piece of that is that these definitions of open, closed, and positive, we actually worked through the safety operational subcommittee on how to write that and what was made the most sense with the definition of what it was. And from the beginning, we have not named the difference between staff and student. We said individual, maintaining as much confidentiality as possible.
No, I agree with that. And then my second question is, we brought up the issue of mask wearing. You may have students coming in day after day, week after week without doing the self-certification. Is there going to be a follow-up if there's someone who's chronically always not doing it?
If there is somebody chronically not doing it, we're missing something. So somebody has not done what the procedure says and what we have trained. So there is an absolute 5 minutes after the bell rings, follow up on that report. If you recall, there's a whole column on those that did not, that the students were not self-certified by their guardian. And as those follow-ups will continue, we'll ask those students to come down. A staff member in secondary may be able to self-certify that student without a parent, but we're really not leaning on that. We want the parents and parents and guardians involved in that self-certify. So if you're listening, folks, make sure you self-certify and make sure you get that app, make sure that works. And I know that our principals, for the most part, have been asked to, and are asking parents to start practicing sooner than later on their passwords and all that other pieces of the program.
And again, I'm going to follow up with people who don't seem to be doing it continuously.
Yes.
Yes,
Oh,
okay.
yeah,
Yes.
absolutely.
No, so
Absolutely.
to be, first of all, even today, I kind of freaked a bunch of people out because I sent a calendar invite to every staff member for 6:30 in the morning to self-certify from me. And without the context, it kind of freaks some people out. So I've been getting emails all day long as a result of that, but we're pushing notification to staff. We've made it very clear that it is an expectation. If you're coming into a building, if you're a staff member, you will self-certify. If you're not self-certifying, there will be appropriate consequences if you continue to not do that. For families, our principals have a variety of systems that they're sharing practices with each other, but the expectation is that we follow up with families if a student is not self-certified.
And where you're maybe getting and you probably got feedback from staff around and emails that said we're not doing that because we originally were just keeping kids in school and we're not excluding, and that was our stance. We said that we're not excluding kids. They haven't self-certified, stay 6 feet away. That was our stance 2 months ago. And in that has transitioned to be a full follow-up plan for every student who doesn't self-certify and to make sure that we're following up on that. And this is the pandemic safety procedures document. We update that with highlights. There's a very, very hearty table of contents. Self-certification is the number 2 topic. You go down to the bookmark, and we're starting to lay those procedures out. I'll finalize all this by tomorrow with Dr. Johnson and the secondary and the elementary assistant superintendents. We'll finalize all that in the morning.
I just want to be clear, even with that, we are not excluding students if they don't self-certify. They still arrive on our doors. Once they're at a bus stop, they're our kids. And so I just want to dispel the myth that we're going to not allow kids into school if they're not self-certified. If they arrive not self-certified, we will follow up with the families. We will do what's appropriate from the administrative perspective. But once a kid's at a bus stop, they're our kid for the day. So we'll figure it out once they get there.
Can I add one thing to that? As you were talking, I was in my head starting to think about, okay, what am I going to do in the morning? I got 3 kids. And it occurred to me that my daughter is 17 and a half years old. Can we set up some sort of system that the kids 16 and older can self-certify or?
They really can't. They really can't legally. But what we're working out is because we're in local parenti, we may be able to work out some of that with an adult member and the nurse at the secondary level, but certainly not the elementary level.
Okay. So does that mean a 17-year-old can or cannot self-certify?
Cannot.
Okay.
But they may be able to in person with our procedure that we're developing in person with a staff member if we have to follow up. So if they're 17 and a half or 18, they could be 18 in our building. We're still asking the guardians to follow through with that.
Okay.
And if you are a parent, you can do all 3 kids with 1 sign-in.
Oh, okay.
Right. And if you're a staff member, you can do 1 sign-in and your kids all in 1 sign-in and do all of them at the same time.
Okay.
Right. Yeah,
Okay. No, that makes sense then.
Yeah, I think that's something we've been working on for all families and staff is that the systems are collaborating with each other.
Yeah.
So that you can, if you're a staff member, have multiple students, you can come in and do yourself all at the same time. So if you have to do yourself or do 1 child, you can do all 3 at the same time.
Yeah. Okay. Awesome. Thank you.
Cool.
So I have a question. So the child shows up at school, they have not self-certified, they go into the regular classroom. There is no place else for them to go.
They may, it depends on the size and scale of the school. That might happen. Some principals are working on trying to make sure that they're doing that at the doorway to try to check and run the reports before. It's going to depend on when the parent or guardian actually do the self-certify. So yes, the student may end up in the classroom, and then that's the ask of the administration to start 5 minutes after the bell and start collecting that information. And that's why the room number and the whole room teacher are on that report. So then that administrator can quickly identify the students who have not submitted the self-certify or their guardians did not. So we can track those students down and make those checks.
Ms. Porter, if I may also just talk through that a little bit more so. So really looking at this, as Mr. Sanders suggested, from the elementary perspective and then at the secondary perspective. So for example, we know we have elementary returning tomorrow. And what will start to happen tomorrow morning, 6:30 a.m., reminder email will be sent to any staff member who has not yet completed self-certification, and that goes out as a district. So when Mr. Sanders suggested or stated that he had sent a calendar invite to all of us, that's why, right, to encourage that we do that. Expectation of all staff members, starting with staff, starting as adults, starting those of us who are the models for our young people, is that we all self-certify an hour in advance of reporting to our sites. Principals will start to receive those reports an hour in advance of the start of their school day. It will include staff, it will include students. 30 minutes later, they'll have another report, and then they are able to run those reports as well throughout the day. We are asking that 15 minutes prior to the start of the day, we have administration, health services, secretarial support that can start to run those reports as well. So we know at that point, we may likely have some students who are on buses, who are in cars, who are on their way to our sites, who may not have completed self-certification. At the elementary level, those students will enter the building. We may be able to identify students on their way into the building and immediately start that process. Otherwise, as Mr. Heiderscheit identified, the expectation is that within 5 minutes of the start of that day, we have administrative health services teams who will be working at visiting all of those classrooms and identifying those students on an individual basis so as to protect their privacy, all of their rights, to then complete that self-certification component to the best of our abilities. What that entails, as everyone has asked here tonight, is that we do contact the household. So we start by following up with the household and working to help build those relationships, educate, inform, identify any barriers that might be inhibiting the completion of that self-certification component, and then working to complete that to the best of our abilities for that student to ensure, again, to the best of our abilities, that student, staff, setting will be safe. But as Mr. Sanders has indicated, there are students then. And so we have then worked out those processes as well as to how we return students safely to classrooms. If they are not healthy and able to return to the classroom, how do we still support that student and the family as long as they are at our site as well the remainder of the day for the student days, whatever that might look like. So that's our process for elementary, and we'll be working through that again starting tomorrow. The secondary level, as Mr. Heiderscheit and Mr. Judge indicated, we are researching some additional options that could also support that student self-certification under appropriate supervision of adults in the buildings as well. We're also researching how we have technology to expedite that process as students enter buildings at the secondary level, being able to identify upon arrival whether they have already completed that self-certification component or not. Obviously, at the secondary level, students are older. They might have access to greater technology, might be able to address and answer those questions in collaboration with us as well. But all of these efforts will require and necessitate ongoing regular communication right now with our community, our families, our staff, households. This is ongoing, and that will be the effort, pushing both from the district level and the site level as well, and then also individualizing communication as needed. I hope that's helpful.
Thank you, Dr. Johnson.
Okay. Well, thank you very much. Thank you for all your work. I know it's been an incredible 10 months, and this is, I'm really impressed with what you've done. So thank you. Thank you very much.
Thank you.
All right, next item, comments from the audience.
Ruby, would you like to do the portion for the public comments?
Hi, good evening. Yes. Good evening and welcome to the Board of Education meeting. We're now at the public comment portion of the meeting. Attendees wishing to make a public comment tonight were asked to complete a request to speak card form in advance and were then provided with a webinar ID number to call in promptly at 7 p.m. Monday, January 11th, 2020. As always, speakers will be given 3 minutes to share their comment. The board listens to the speakers but does not respond to individual questions or comments during the meeting. A written response will be mailed to the speaker if requested on the form. Those who provided a public comment but chose not to speak publicly in the meeting were asked to submit an email to board@u-46.org. Those emails were posted on the board agenda for public viewing. Buenas noches y bienvenidos a la reunión de la Junta Educativa. En este momento abrimos al público la oportunidad de hacer comentarios. Los asistentes que deseaban hacer un comentario público esa noche se les pidió completar un formulario de solicitud para hablar antes de la reunión y luego se les proporcionó un número de identificación de la reunión en línea para llamar a las 7 p.m. hoy lunes 11 de enero de 2021. Como siempre, los oradores dispondrán de 3 minutos para hacer sus comentarios. La Junta Educativa escucha preocupaciones y preguntas, pero no da respuesta durante la reunión. Si solicitó en el formulario recibir una respuesta, se le enviará por correo. Se pidió a los que proporcionaron un comentario público, pero decidieron no hablar públicamente en la reunión, que enviaran un correo electrónico al correo board@u-46.org. Esos correos electrónicos se publicaron en la agenda de la Junta. Si necesita interpretación, por favor indíquelo antes de hacer su comentario público. Muchas gracias.
Thank you, Ruby. We have 3 public comments tonight. I'll be upfront with telling you the order that we're going to take these are the same order they came in on the Google form. Our first will be Sandra Davila. Next after that will be Amy Schubert, who is here in person. And then finally, we'll have Sean Roberts. So Sandra, you are first up and should be allowed to speak now.
Hello. Hi.
Hi.
Hi. Good evening. Thanks for the space and the time that you're allowing for public commentary in this very polemic going back to school. So I understand that all these safety measures are being put in place, but we are still in the highest positivity rate of the pandemic since it started back in March. So if we shut down schools then, why are we opening them now? The credentials of the school safety and culture director will not take care of students and their families when they get infected and are sick at home. What happens when the principal gets COVID? Because that's happened in other schools that have opened. Like, how guilty are staff members going to feel when they bring the virus to school, when they signed up to help children, not to get them sick? This is the tail end of the holiday season where people spend time in groups. That just makes a remark on how bad of an idea it is and how illogical it is to open schools. We can wait a bit longer now that there's a vaccine to come back school safely. We don't know still what the repercussions are. And this is just a recipe for a super spreading event or situation in the community. Families have not been asked. What I meant by my comment or by the signature petition that was out was that families were asked about their choices to return to buildings in August. And based on that data, the schools made separate lists of students. And since then, the district has repeatedly used those numbers to rationalize their intent to return. And yes, parents have the choice. But at this point, there are stark differences in our community and the numbers of students in classrooms and the disproportionate way that COVID has affected our families of color. So there are many, many points of why this is illogical. And I understand, and I'm very appreciative of all the safety measures that you've taken, but how much money has the district spent on putting these safety measures in place? And could that money be instead used for social emotional need of the students that are at home? There are things that we can do it as administrators or as part of the staff to stay safe. And the best thing that we can do is just to stay home until everyone's safe. This is about the students, and this is about the students' family. And then the students' families go out to work and they go out to places, and it's a holistic view of the community. We need to stay safe as a collective. Thank you.
Thank you for your feedback. Our next public comment is here in person, and it's Amy Schubert. Mrs. Schubert.
Hello. I've been involved in the district since 1998. I've been a parent up until 2020, and my daughter graduated last year from Elgin High School at the Gifted Academy. I'm also in my 10th year of employment at U46, pieced together couple years back at Larkin with Mr. Butler, and then now currently at Elgin High School, where I am currently a substitute teacher. I've been in this position for 4 years now, and what once started as a part-time little side job has turned into quite a nice supplement to my income. And then now during this pandemic, it turned into my main source of income. I was fortunate enough to have pieced together quite a few long-term substitute teacher positions over the past 2 years and had been accustomed to that rate of pay, including in the spring of 2020. I was in a long-term position and I did distance learning for the whole first semester and have been right there side by side with the teachers 100%. And then again, to start this year, I was also offered a long-term position, which I was contracted for from August 17th through January 4th. And that came to an abrupt halt. When I opened my email and I read an automated message from the system that we receive when our job changes as a substitute teacher. And that was my only form of a notification. No one contacted me via phone or email to let me know that my job would be coming to an end and terminated, and that I would no longer be receiving any income. This happened the week of November 20th, 2 weeks after I had lost my main source of income at a high-end restaurant in Algonquin. I was very fortunate and have always been very appreciative and fortunate to have a job at the district, and I'm a valued employee at Elgin High School. I am not being told that I was going to be let go in 5 days. I had a 5-day notice that my job was ending. Did not give me enough time to heading into the holidays looking for another job. Therefore, I had no source of income going into the end of November into December, except for unemployment, which now has been fraudulent, and I can't get that now because I have to prove myself who I am, but that's besides the point. I am always been for the students first. And during these unprecedented times, I was doing out-of-the-box things for my classes in the culinary program at Elgin High School, and I felt that I was doing an excellent job and that I did not warrant not being told that I was no longer needed because the teacher was coming back to take her job back. I'm here just because this cannot happen to another person. It has been extreme financial burden on my family. It has put us through a major hardship. And if there's any way possible that I could recoup any of the money that I was supposed to have earned during the rest of my contract. And mostly I just cannot see this happen to another person. And that is what I would like to end with. Thank you.
Thank you.
Thank you.
Our final public comment for this evening is Sean Roberts. Mr. Roberts is online and you are now unmuted and can speak, Mr. Roberts.
Hello?
Yes, Mr. Roberts, go ahead.
Yes, thank you for the time. Today, sorry, I had it on both my computer and my phone. I really appreciate the presentation today. It was very helpful to hear the information, all the hard work that's being done by the folks to keep folks safe, and the work's being done is great. I am commenting, I have 3 young kids in 1st, 2nd, and 4th grade, and really struggled with U46 and kind of the education as far as lack of education that's gone, particularly seeing other districts that have returned. Nephew that's been in school since August the 6th, U46 decided to start a week late. They decided to make the decision to go back to a hybrid or in-person learning on October the 26th, when all scientists and data had indicated that we would see a spike in COVID cases, which was the case. I do not blame for going back to remote in any way, shape, or form. And as the cases went up, completely agree it was the right decision to make. But with the lost education, I'm really want to know from the school district is, how are we going to make up for the education that was lost? What are we doing to protect the teachers, maybe in a bigger way? Both me and my wife are both in the 1B group. I do not want my vaccine before teachers. I think teachers should begin it first. Are we pressuring our government agents to get in line first? So it's just as the second biggest district in the state, I think I would hope that we have some pull and some power to really help in this area. I really like the idea of the site by site as a big district, thinking about things different. But the main thing that I want to push is, how do we get from the hybrid model to full back in school? Obviously, right now the times aren't good, but as the vaccines rolled out, as the case numbers start going down, as I expect they will, as we get through the holiday season and get back to the spring, what are we going to do to get the education back to the full 5 days, get students back in school? What are we going to do to make up for the lost time for education for students? Two of my kids, one's ADHD, one's was very young in his class and is quite behind in reading, and I would really struggle with him going to the next grade at the current moment. So are we going to do stuff to make up for those lost opportunities, special classes, extra learning opportunities for both the kids that fell behind, but for all kids? And those are the comments that I wanted to make, and I really push that we're thinking about education first to get these kids back in school. Do it safely. I think we can do it. I've been working in a situation where I've had to go to work. We've got the measures in place. We do the right things. Kids learn fast to wear masks. The other thing, the last comment I want to make is, kids are going to have to go out. I mean, I've seen it. I have to send kids to the local park district, as both my wife and I have to work. They have a stomach flu, they got to be gone. And so we got to deal with it. We got to get, so how do we keep the kids learning, getting the same education, even though they might not be sick, they might not have COVID, but make sure they're getting that same education if they were in school in a hybrid or in a full 5-day model. So thank you for your time.
Thank you very much, John. Appreciate that.
And that are the comments, Mr.
Correct. That concludes the
Okay.
public comments.
Okay, next item, our board member and superintendent update. Any updates? Okay. Did I miss anything? No.
FOIAs. Oh.
FOIA request.
So before the Board of Education on board docs and available for public consumption are 14 Freedom of Information Act requests that we've had since the last board meeting. These will also be posted on the district's website in the coming week.
Okay, thank you, Mr. Sanders. Next item is presentation by ETA President Barb Bettis.
And Ms. Bettis is available on Zoom, and I have unmuted you, Barb, so you should be able to share your comments.
Okay, well, thank you, and good evening to everyone. Frankly, I was a little bit taken back this evening by that safety presentation. And I could not believe some of the mistruths that I heard that were presented this evening. And my colleagues, my fellow teachers could not either, as my phone was blowing up as that safety presentation was being shared this evening. So before I begin my prepared message that I did share out with the board members, I would be remiss if I did not clarify some of the information that I heard this evening. So first of all, I heard a lot of reference to ETA and ETA collaboration. Believe me, if everything went as stated, I would not be standing or sitting here in front of you this evening about to read what I'm going to read. Nor would we have had over 400 teachers standing in the street today asking for safe schools. So if that safety presentation was everything that was stated tonight, school board members would not have gotten those emails. 400 people wouldn't be in the streets, and I would not be reading to you this evening. So let me also clarify that our teachers have not seen that safety presentation. And our elementary teachers and our special ed teachers are walking into the buildings tomorrow, and there are so many things that are not in place. We talk for collaboration, but if there was true collaboration, I would have been at those meetings like it was stated. Dr. Johnson explained self-certification this evening, and I was part of that conversation on January 5th. January 5th is when I found out that self-certification was going to be implemented. After I've been asking for self-certification for months and was told we're not going to do it because it's exclusionary. And then I was also told ETA doesn't make the rules. But then on January 5th, we had a conversation where I learned that finally we were going to do self-certification, but I can also tell you it's a work in progress. And again, our kids are going back in the building next week, or tomorrow and next week, and the details have not been worked through. I also need to address the previous trainings because my phone was blowing up over that. Teachers do not feel prepared. They do not feel prepared to walk in the buildings. The trainings for teachers have centered on the Spanish flu and how it impacted society, and believing that a growth mindset is all teachers need to feel safe in the building. And that's not the case. That's not the case. If the teachers would have received just a portion of the safety presentation this evening, it would be a lot different, but they haven't. They haven't seen the safety presentation. They are busy in their buildings, working with their school departments, trying to figure out what safety can look like. But that again is put on the buildings and it's put on the teachers. So I thank you for asking about the masks, Ms. Porter. We too were asking about the masks and what would happen if students didn't wear masks, because we were given many, many mixed messages along the way. So I thank the school board for asking the right questions this evening, because we too as teachers are asking that same question. We have a lot of work to do, and that's why the teachers are asking for you to listen to them, because they have high anxiety at this point, not because they don't want to go back into the building. So I'm going to read my prepared statement now. So I asked to be placed on tonight's agenda so that I am able to share and talk with you this evening on issues that have never been more important, and that is making the correct decision on whether to have students, teachers, and other staff members return to in-person instruction at this time. It is my responsibility as the president of the Elgin Teachers Association to speak on behalf of our 2,600 plus members. We surveyed our membership about the current situation and the return to in-person learning, and we heard back from 80% of them, and that is the information that's helping me guide my comments tonight. So tonight, I came here to call for a safety plan to be strengthened, specifically by creating a collaborative system to monitor compliance and enforce safety expectations, because I don't believe it currently exists. So I want to start by bringing your attention to the growing concerns around the lack of detail, the lack of clarity, and the lack of communication to all stakeholders as we return to the buildings. Since July, the same concerns surrounding safety were brought forward, and it wasn't until Friday that any attempt to directly address the concerns of teachers was made by Superintendent Sanders. We continue to hear that other districts have figured out how to return, and so can we. But to do so, we need a fully developed safety plan. Safety plans like other districts have, and we don't have that at this time. This was never more evident than at the end of November when we were struggling with any regards to implementation. So that evening, I intended to address this at the November school board meeting, but thankfully the Kane County Health Department called for an adaptive pause to in-person instruction. I rewrote my message to the board that day, thankful for the pause, and thought the district would work on improving the safety plan protocols and communicate those improvements to the community. Shortly thereafter, analysis of compliance data, limited as it was, highlighted our need to improve understanding of expectations for all. And then to add additional stress, teachers with family members at home who made them high risk, who completed all the documentation as required by the district, were denied the day before prior to winter break. And to date, a number of our teachers are still awaiting a resolution on their applications. And they start school tomorrow and they start school next week. Also, the days previously provided from the Families First Coronavirus Response Act, FFCRA, expired, and the district did not communicate any options for teachers that would be made available should they contact COVID. That is why this evening in front of the district office, our teachers, your teachers, held a rally calling for the safety plan to be strengthened, and specifically by creating a collaborative system to monitor compliance and enforce safety expectations. So you see, we don't believe that collaboration truly was existing. ETA continues to believe in collaboration and working with the district. In fact, over 75 ETA members have sat in committee meetings since July. They have done this for no additional pay and with a desire to be problem solvers and get our kids back to school. What once was only to be a few meetings turned into members coming to the table week after week, creating schedule after schedule to meet the needs of our community. We still believe in that collaboration, and it needs to happen in order for us to get our schools safe with plans that reflect the needs of those who are in the buildings. And I want the board to know, as well as the rest of the community, the ETA is not against in-person learning. Our stance has always been that we want our students back in the classrooms. We have never wavered from that point, but we want our students back in the classrooms when it is safe for all. And today, we do not believe we are there yet. So I wish to share with you an excerpt from an email from one teacher who captures the beliefs and the feelings of the majority of our members. And it speaks to how we as teachers are not opposed to being in buildings, but we are asking for that safety protocols be put in place. And it begins with, I deeply miss my students and colleagues. I miss joking around with my students, getting to know them as people, and seeing them succeed in school and life. I miss seeing my colleagues, greeting everyone in the morning, swapping stories at lunch, and using their wisdom to improve my own practice. I miss walking into the class ready to teach only to have the class derailed because of the dumbfounded looks from my students or a joke that snowballed into something hilarious. I miss all these things, and I wish I could have them right now. And he concludes with, but now is not the right time. A pandemic is raging and a new COVID variant is spreading. This email reflects very much how the majority of our teachers feel. This past week, ETA has worked diligently with Dr. Johnson, Lala Majstorovic, and Steve Berger to identify the major concerns and continue the work. ETA is calling again for the safety plan to be strengthened, create a collaborative system to monitor compliance, and enforce those safety expectations before our students and teachers return. There must be a commitment to get this done. However, it is January 11th today, and students go back tomorrow, and the work is still in progress. Secondary teachers returned to the buildings today only to find their rooms in disarray and nothing was ready. We should not send teachers and students in buildings with anything less than a fully developed safety plan that has been fully communicated to all stakeholders. Some of our buildings are more ready than others because of the work our teachers and their school departments have done. But this is not how a district safety plan should be developed. There should be non-negotiables and procedures that fit all of our buildings. Instead, all we can do is hope that each individual site has put in more work than they should have in order to get the district's plan across the finish line. So what I'm calling on our school board and our school district to do tonight is to provide the time needed prior to students returning to address the following. Again, strengthen our safety plan, specifically by creating a collaborative system to monitor compliance and enforce safety expectations. Let me just add, this is not occurring at the safety committee. Secondly, once in place, we are asking that the plan is communicated and adhered to by all of our stakeholders. And lastly, we share a responsibility to make sure our students, our staff, our community members are safe. We are the largest school district in the state, the second largest school district in the state. There are 38,000 students who attend our district. If U46 cannot conduct in-person safely, we are putting families in 11 different communities at risk. We have a shared responsibility to make sure our students, our staff, our community, all our stakeholders are safe. So I thank you for your time this evening, and I welcome any questions. I did receive a lot of text messages this evening from teachers. They are asking that I extend an invite to the school board members that you would visit the buildings and speak with the teachers to understand what they're saying and what they're experiencing. So thank you.
Thank you, Barb.
Thank you, Dr. President Kerr. Thank you.
All right, I guess we move on.
All right.
The consent agenda, Mr. Sanders.
Thank you, Madam President. On the consent agenda, we have a personnel report and workers' compensation cases, minutes of the board meeting, December 7th, 2020, minutes of the board meeting, December 14th, 2020, Alignment Collaborative for Education renewal, a bid from Plant Operations for Streamwood High School Painting Project Phase 3, Project M0064, bid from Plant Operations for South Elgin High School lift line replacement and retermination, change order from Plant Operations for 1019 East Chicago Street Phase 2, Project number 2054, a change order from Plant Operations for Abbott Middle School Chimney Repair Service, Project number 356, change order from Plant Operations for Bartlett High School and Spring Trail Elementary School Resurfacing Improvement Projects number 206 and 1425, a change order from Plant Operations for Coleman Elementary School Ventilation HVAC Project number 682, a change order from Plant Operations for Larson Middle School Site Improvements Project number 501, a change order from Plant Operations for Larkin High School Electric Service Main Replacement Project 263, change order from Plant Operations for Larkin High School Nurses Office Project number 262, change order Plant Operations McKinley Elementary School Lower Level HVAC Project number 1202, and finally applications for approval of 10-year survey reports and certification of need for fire prevention and safety funds for Bartlett Elementary Amendment number 20, Bartlett High School Amendment number 7, Canton Middle School Amendment number 12, Clinton Elementary School Amendment number 16, Elgin High School Amendment number 18, Gifford Street High School Amendment number 23, Harriet Gifford Elementary Amendment number 20, Horizon Elementary Amendment number 10, Kimmel Middle School Amendment number 18, Lords Park Elementary Amendment number 10, Memorial Field at Elgin High School Amendment number 3, Millennium Field at Streamwood High School Amendment number 4, Ontarioville Elementary Amendment number 16, Park Ridge Elementary Amendment number 11, Streamwood High School Amendment number 15, Sunnydale Elementary School Amendment number 14, and Willard Elementary School Amendment number 17.
Okay, thank you. Are there any items that members would like removed from the consent agenda? Okay, could I have a motion to approve the consent agenda?
So moved. This is Kate. Second, this is Veronica.
Roll call, please.
Deborah,
Yes.
Lily,
Yes.
Owen,
Yes.
Porter,
Yes.
Smith,
Yes.
Yes.
Yes. Discussion action, Mr. Sanders.
Our first item under discussion action are itemized bills for January 11th, 2021. Mr. Burnage is with us in his office and on Zoom for if the board has questions. Administration recommends the Board of Education approve the list of bills in the amount of $15,098,672.29.
Could I have a motion to approve the list of bills in the amount of $15,098,672.29?
So moved. This is Veronica.
Second, this is Melissa.
Any discussion? Questions? Roll call, please.
Yes.
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 The next is the government surplus agreement. This is a document that requires the signature of the board president in order for us to participate in the government surplus program. Mr. Phelps, before we get a motion in a second, would you mind giving the board an overview of what this entails?
Absolutely, Superintendent Sanders. So what this will give the district access to any federal government equipment that is no longer needed at no cost. The only cost that the district would curtail is the movement of the equipment from the location that it's currently at to the district. So if the board approves, what we will do is we will get access to a website. We'll be able to review the equipment and work with any and all departments to see if there's any interest in any of the type of equipment that they have made available to all school districts and state entities. And then once we figure that out, then the business department will work with the federal government on obtaining that equipment and getting it here back to the district.
Thank you, Mr. Phelps. Could I have a motion to, I guess, approve the government surplus agreement?
So moved. This is Kate.
Second, this
This
is
is
Veronica.
Eva.
Are there any questions? Mr. Phelps, have we had done this in the past and have we gotten equipment?
We do not have a formal agreement with the federal government or state government for surplus equipment.
Okay. Okay, any other questions? Roll call, please.
Yes.
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 Yes. Okay, other business, CAC update. I'm not sure there's anyone.
I'm looking in the attendee list. I do not see any names that sound like CAC representatives. If there are, if you could click raise your hand on the attendee box so I can unmute you.
It's not.
No, it does not appear so.
Okay, other business, Mr. Sanders.
Under other business, before we get into tonight's work session, we thought it'd be a good idea for the board to get an update on our capital projects that are anticipated for this upcoming spring and summer. And so here to present the capital project summary is Sheila Downs, Director of Plant Operations, and then Dr. King is also available with her as well. Sheila?
Good evening again, board members. You were provided with a list of our FY 2021 capital projects. It lists the estimate for each project, the project description, and as well as the school where the project will be taking place. And then it tells you which funding source will fund the project. And so some of the projects, most of the projects are going to be funded from O&E funds that are identified for capital projects. We do have health, life, safety funds that have been allocated for items that have been identified on our health, life, safety reports that you review each year. Maintenance and grounds budgets have allocations for particular projects. And then we received a $50,000 grant, a school maintenance grant that will go towards the Ridge Circle domestic water projects. With that said, I'll open it up for any questions you may have.
Does anyone have any questions? Melissa?
There's just one quick question. One of the more, I don't know, for lack of a better word, expensive renovations on the list is the mechanical work and remodel, replace lockers at Elgin High School. Is that, they're two separate things, right? There's mechanical work being done and then work on the lockers.
That's correct. And so while we're at each site, we try to be as efficient as possible. And so there is going to be work happening in the locker room at that location. However, we are moving the boiler room to the mezzanine of the locker room. And we're also replacing the power poles. A lot of the wooden power poles have been there for 50 plus years. And so they are rotting. And so because our internet lines as well as our ComEd lines are fed to power the school from Route 19, it's emergent that we replace those power poles before they fall. So while we're at that site, we're going to make the most of our time and mobilize once. And so we will address the interior of the locker rooms, but the impetus was truly the mechanical systems at that location.
Okay, thank you. That was my question. I didn't know if those were lockers that were out in the hallways or within the locker room. So thank you for that.
You're welcome.
I believe those are the ones, those are the lockers that are beneath the stadium. Those just, right?
Correct.
Those are the stadium lockers that had been dripped into because the stadium was leaking and starting to erode.
Yes, that is correct, Dr. Sanders.
Thank you.
Any other questions? Okay, next item.
Now we are on to work session items, and our first is the dual language social studies elective resource only proposal. And here to present that is Jacob Van de Mortel. Welcome, Jacob.
Hello. I just want to confirm, is the PowerPoint on the screen?
Yes.
Okay, then I will go ahead and proceed with what ought to be a relatively quick and straightforward presentation on a proposal to bring new Spanish language resources to dual language classes. And did it advance? I apologize. It is not showing up on my screen.
It is not advancing, unfortunately, no. Eric, now it is. A lot.
I apologize. It's a new setup. Okay. So let's dive in then. We are looking at bringing forward 2 Spanish language resources to support more elective options for dual language social studies students. We believe this will speak to the strategic plan as far as student achievement goes, because of course students can achieve better when they have resources that are in their language of instruction, as well as we believe it will support our staff and keep them engaged, because again, they will have the resources to teach the class in the language that is appropriate to. The rationale here is that as our dual language students continue to roll through the high school, there is a language allocation cap where a certain percentage of their classes must be in Spanish and a certain percentage must be in English. And as they get older, closer to their senior year, things like academies and pathways and programs like band or autos kind of pigeonhole them to they must take certain classes in English, and it reduces their elective flexibility for Spanish language classes. So we in the Curriculum and Instruction Department have been looking for several years now to increase the number of Spanish language electives that are available for our dual language students. And so tonight I'm proposing that we add dual language versions of our already board adopted curriculum for dual language intro to psychology and dual language world geography. So this process began over 2 years ago when we issued a call to committee and began to evaluate what existing courses could we properly resource with Spanish language materials to make sure that there were Spanish language options for our students. And so the resources we bring tonight, just like what I've brought to you in years past, have gone through vetting through the curriculum instruction team, through professional development team, the committee, through instructional council, through the cabinet, and we've brought it here tonight for seeking your approval. So the recommendation, like I said, is to add dual language intro to psych, a 1-semester course, and dual language world geography, which I'll actually go to the next slide because it's a bit more robust and visually laying it out. As you can see, as students progress through high school, there are progressively more social studies options available in Spanish. And what the case is that typically students take their electives in social studies earlier in their high school careers in 9th and 10th grade, and we didn't have as many offerings for our dual language students. And so adding world geography and intro to psych as dual language options provides opportunities for dual language students as freshmen and sophomores to have courses in Spanish to meet some of those needs, to provide greater flexibility as they advance through their high school careers. So specifically tonight, we're asking to adopt for dual language intro to psych, the textbook Psychologia. I'd like to give a special shout out to Dr. Hilda Rivera in our ELL department, who actually found this standard secondary psychology text from Guatemala that's going to work for us. And we had wanted to do this actually last year, but due to COVID, we were unable to import it. We had to kind of put that on pause. So I'm very pleased tonight to bring it forward as an option for this coming school year. And then for dual language world geography, we're looking at geography, the human and physical world, the Spanish student edition, which is very convenient because it is the Spanish version of our already board approved English text for the same course. And we're also very pleased that in previous years, this book was not the hard copy was available, but there's no online version. And starting next year, our students will have access to nearly all the materials in Spanish online, which of course we've learned more than ever is quite important. We're looking at implementation for next school year with the materials being distributed over the summer, and then using this days before school begins next year for professional development for the teachers who will be using these textbooks to make sure that they have everything they need, both technologically and pedagogically. And of course, to review that per our evaluation, our curriculum cycle. Cost-wise, over the course of 6 years, which is what the online licensing for both these is, you're looking at a grand total of $91,996. Or as it breaks down, $153.33 per pupil. And I think more importantly, $25.55 per pupil per year for 2 separate textbooks, which would enable 2 separate dual language social studies electives. And so our committee work is not done. We are continually looking for additional Spanish language resources that would allow us to teach more of our existing curriculum in Spanish and provide more flexibility and options for our dual language students. So we will continue to meet looking for those and continue to meet and evaluate how these resources are working, how the technology is being implemented, and then obviously monitor if that's working towards the student outcomes that we desire. That concludes this presentation.
Thank you, Mr. Vandermotel. Do board members have any questions? Okay, it looks great.
Thank you, Jacob. Appreciate it.
Thank you.
Our next work session item is a contract renewal for the assessment office for the cognitive abilities test, COGAT. Mr. Phelps is with us, as well as Dr. Carpenter, the assistant superintendent for teaching and learning, and Mrs. Wells, gifted coordinator. Administration recommends approval of the contract renewal with Riverside Insights in the amount of $52,470 and requests authorization for district administration to execute related documents. This expenditure will be charged to the educational fund and is in the budget for the 2020-2021 fiscal year. I also want to just note for the record, if you'll see in the proposal, a lot of work went into making sure that we can adapt this as needed in the midst of a pandemic to continue forward with our testing. So thank you, April Wells and team who made that happen.
Are there any questions about this proposal? Okay, thank you.
Our next is a contract renewal for business services and financial operations for employee retirement plan investment advisor. Mr. Phelps is with us again, and Mr. Burnage is also available to answer board questions. Administration recommends approval of the contract renewal with RVK Inc. for 5 years in the amount of $328,105 and requests authorization for district administration to execute related documents. This expenditure will be charged to the educational fund and will be included in the budgets for the 2020 to 2026 fiscal years.
Are there any questions? Okay, moving on to bids and proposals.
It is now what we affectionately will call the Sheila Downs Show. So Bruce and Sheila are with us for a lot of different projects. The first one is a bid from Plant Operations for Hillcrest Elementary School Domestic Water Replacement, project number 927. Administration recommends the award of the low bid meeting specifications to Northwest Contractors, Inc. in the amount of $885,000 and requests authorization for administration to execute the documents. This expenditure will be charged to the Operation Maintenance Fund in the amount of $300,000 and the remaining balance of $585,000 charged to the Health Life Safety Fund. And this is included in the budget for the fiscal year.
Are there any questions? I just had one general question. A number of these proposals are reflected in the capital project summary that was presented earlier. The capital summary gave an estimate of what the cost would be, and this is actually the real cost, I take it.
Correct. So we work with our A&E firms, which is our architecture and engineering firms, to identify projects at that time based on a lot of different variables. They do give us estimates. And typically those estimates, they take into account inflation, product costs, labor, COVID now. So they do their very best to estimate, but we don't really know until we get bidders. And so often you'll see a lot of our bidding come in slightly over or slightly beneath. If it is over, then the A&E firms do have to report what the variation was from what the original estimate was presented.
Okay, thank you. Any other questions? Next item.
Our next is a bid from Plant Operations for Liberty Elementary Insulation Project, number M0056. Administration recommends award the low bid meeting specifications to USA Insulation in the amount of $26,492 and requests authorization for district administration to execute related documents. This expenditure will be charged to the Operation and Maintenance Fund and is included in the budget.
Are there any questions? Okay, next item.
The next is a bid from Plant Operations for Ridge Circle Elementary School Domestic Water Replacement Project number 1375. Administration recommends of the board of the low bid meeting specification to Northwest Contractors, Inc. in the amount of $1,039,000 and requests authorization for administration to execute the documents. This expenditure will be charged to the Operation Maintenance Fund in the amount of $539,000, with the remaining balance of $450,000 being charged to the Health Life Safety Fund. An additional $50,000 was also awarded for this project through the Illinois School of Education Fiscal Year 2020 Round 1 School Maintenance Project Grant. The cost is included in the budget for the fiscal year.
Are there any questions? Okay, next item.
Next is a bid from Plant Operations for Elgin High School Domestic Water Piping Replacement Final Phase Asbestos Abatement Project number 0240. Administration recommends the award of the low bid meeting specifications to High Efficiency Professional Abatement, Inc. in the amount of $162,300 and requests authorization to execute the documents. The expenditure will be charged to the Operation and Maintenance Fund and is included in the budget.
Are there any questions? Okay, next item.
Next, we have the bid from Plant Operations for Ronald D. O'Neill Elementary School Domestic Water Replacement Project number 1401. Administration recommends award of the low bid meeting specifications to Northwest Contractors, Inc. in the amount of $744,000 and requests authorization for district administration to execute related documents. This expenditure will be charged to the Operation Maintenance Fund in the amount of $255,400 and the remainder $488,600 being charged to Health Life Safety, and it is in the budget.
Are there any questions? Melissa?
I don't have a question about this item, but can we go back to item C, the bid for Ridge Circle Elementary
Sure.
Domestic Water Project? Mr. Sanders, the grant that we're getting from the Illinois School Board of Education, Round 1 School Maintenance Project Grant, is that part of that backlog of grant money that they had out there for
school projects?
For maintenance projects?
The backlog, so if it was a capital project, where the backlog typically exists is with the, for building new buildings and things like that, that's through the Capital Development Board. That's where they have all the outstanding. I don't believe this is related to that same fund.
Okay.
Ms. Downs, do you know the answer to where the source of this fund? This isn't through the Capital Development Board, is it?
I don't believe so. I know that they rolled it out and they sent it to all the school districts. I'm not sure where it is generated from, but I know that we had to apply. So I can definitely find out though. So I'll add that to my list and I'll email the response tomorrow.
Yeah, no, I'm just curious. There's no rush to get that to me.
Any other questions?
Thank you.
Okay.
All right, next would be a bid then from Plant Operations for Streamwood High School Paint Removal Phase 3 using chemical stripper project first floor number M0064. The administration recommends award of the low bid meeting specifications to Celtic Removal, Inc. in the amount of $430,000 and requests authorization for district administration to execute related documents. This expenditure will be charged to the Operation and Maintenance Fund and is included in the budget.
Any questions? Ms. Downs, I noticed that we only had one bid on this project. Is this the same company that has done the work for us in the past couple of years?
It is. And so Celtic has done the work previously. It is intensive. In the previous years, we also have not gotten a lot of responses, only because it is extremely labor intensive. And so that is really what our engineering firm has reported back as to why we're getting a low response. A lot of people aren't familiar with this process. And with the cinder block, they're literally putting the chemical on it. Then they put paper strips on it, and then they by hand have to remove each of the blocks. And so it does take quite a bit of time.
Okay, thank you. Okay, I believe that is the last item. So could I have a motion to adjourn, please?
So moved. This is Veronica.
Second, this is Melissa.
Roll call, please.
Deborah,
Yes.
Ms. Nolan,
Yes.
Ms. Owens,
Yes.
Porter,
Yes.
Mrs. Smith,
Yes.
Ms. Thomas,
Yes.
Madam President,
Yes.